Hello, and welcome to the State Oversight Academy Symposium. I'm Ben Eike, Manager of State Training and Development at the Levin Center for Oversight and Democracy, headquartered in Wayne State University Law School. The theme of this year's symposium is Legislators and Academics in Partnership. Today, we have a packed schedule full of innovative research and engaging discussions to help bring this partnership theme to life. To improve oversight, the Levin Center's State Oversight Academy works to strengthen legislative oversight as a pillar of democracy through training, research, public education, and convenings like this. Last year, the State Oversight Academy Symposium connected scholars who study state legislatures with practitioners who serve as elected state lawmakers or as legislative staff. This year, we take the same concept a step further. Equipped with scholarly research, how can practitioners put these facts into practice to improve oversight in state legislatures? This virtual event begins with practitioners and scholars in dialogue on 4 academic working papers. After the paper presentations and discussions, join us for a roundtable on legislators and academics in partnership. Following the roundtable, the director of the Levin Center, Jim Townsend, will recognize this SOA oversight leader. For the full agenda, visit the Levin Center's website. With us is the academic director of the State Oversight Academy, Professor Marjorie Thompson. An expert on state legislature research, especially term limits and state legislative oversight, Marjorie is a constant source of leadership and guidance as the SOA grows. Marjorie, please help us begin today's symposium.
Good morning and welcome to everybody. I'm really thrilled that there's increasing interest in state legislative oversight. It's a topic, an activity, a responsibility of the legislature that I think all too often doesn't get the attention it needs, both from those in government, the general public, and especially media coverage. I'm looking forward especially to the practitioner comments on scholarly research. As someone who's done scholarly research, I think it's especially important that what we do is relevant for the people who do the job of governing. And so I'm thrilled to be here and looking very much forward to listening to the papers and to the practitioner comments. Welcome.
Thank you so much, Marjorie. Now it's time to welcome Benjamin Goehring and Ted Booth for the first paper presentation. Benjamin, in addition to having a great name, is a PhD candidate in the Department of Political Science and the Ford School of Public Policy at the University of Michigan. His paper is titled Partisan Departures from the Administrative States. The reviewing practitioner is Ted Booth, Executive Director and Staff Counsel at Performance Evaluation and Expenditure Review in the Mississippi Legislature. Benjamin and Ted, welcome, and the floor is yours.
Thanks, folks. As Ben mentioned, my name is Ben Goehring. I'm a PhD student at the University of Michigan. A big thank you to the Levin Center, especially Margot, Kyle, Ben, and especially Ted for putting this on today. I really appreciate the opportunity to be here today, talking to you all about my research on U.S. state bureaucracy. But I actually want to start today with a story about shrimp, in particular about an agency in the state of Mississippi that's tasked with regulating shrimping. And so that agency is the Mississippi Department of Marine Resources. In addition to regulating shrimp harvesting in the state, it also regulates boating, fishing. It helps preserve coastal waterways and coastal lands. And so about 12 to 13 years ago, the Mississippi Department of Marine Resources was headed up by this guy over here, Bill Walker. And in November of 2013, Bill Walker, along with his son and about 7 other staff members in this agency, were indicted on state and federal fraud charges. Bill Walker ended up spending years in prison and just, I think, recently finished paying his restitution to the state. And they were, among other things, directing federal funds towards buying land owned by friends and family. And so this was a significant scandal. And in the wake of this scandal, the Mississippi State Legislature and the governor decided to really shake things up and reorganize this agency. And in order to facilitate that reorganization, what they decided to do was remove, for a 6-month period, all civil service protections for career employees within this agency. And so civil service protections are a set of protections enjoyed by career staff that prevent them from being fired for political reasons. So usually it means that that career bureaucrats can only be fired for cause. They can appeal their terminations, making it hard to get rid of them in many cases. And it also sets limits on how career employees are hired, specifically usually detailing specific merit procedures by which employees can gain access to these jobs. And so this removal of bureaucrats' protections is an increasingly common phenomenon across the US states. Over the last 30 years, a number of states have cut back on bureaucrats' protections, and in some cases, in most cases permanently, and at a much wider scale than this specific case of this agency. So Florida, for instance, in 2001 removed bureaucrats' protections, making them all at-will employees for this senior echelon of about 10 to 15,000 Florida employees. And in Georgia in 1996, they actually made all employees in the state at will, so they could be fired without being able to appeal their terminations. And this is also very relevant at the federal level, this process of reclassifying employees out of this protected civil service system. President Trump tried to revoke senior federal workers' protections at the end of his last term. And if he's reelected, it's very likely that that's going to be one of the first things he tries to do. And so what I'm interested in today is whether, following these events, executives take advantage of them to try to remove political opponents from the bureaucracy. So in particular, when career employees become easier to fire, I'm interested to see whether executives exploit that opportunity and try to make the bureaucracy, try to refashion the bureaucracy to contain more people with similar policy views to themselves. And so today I'm going to kind of split that up into two different questions. And the first one is going to be kind of this descriptive point, which is whether the conditions that exist in the US states for political targeting. Are state bureaucracies ripe for this kind of targeting in the wake of removing civil service protections? And what I mean by this is that if political targeting does happen, it's likely going to happen because there's tension between senior influential bureaucrats in a state and the principals within the state. So agency leaders who are politically appointed, as well as the governor. And so I'm going to show you today, using this new data set that I'll talk about more on the next slide, that the senior echelons of a lot of Republican states, and I'm focusing on Republican states because those are the states most likely to remove civil service protections. The senior echelons of a lot of these Republican state bureaucracies are staffed by a lot of Democrats. And this is a very new descriptive fact that nobody's really been able to get at before, that I'm able to kind of shed some light on because of this new data set of state level personnel records that I've collected. And then with that kind of those kind of preconditions set, I'm going to dig into this specific case of reclassification in Mississippi. So I talked about the Mississippi Department of Marine Resources at the top. Mississippi's exempted a number of other agencies for temporary periods from the civil service system. And I'm going to look at whether, following those reclassification events, Democrats were more likely to leave the state workforce than Republicans. And I'm actually going to find no evidence that in this case of Mississippi removing civil service protections, that Democrats were any more likely to depart than Republicans. And I'm going to close by kind of talking a little bit about why I think that might be the case, as well as why I think that doesn't necessarily mean that these are completely apolitical processes. So I'm going to start by introducing this very cool, massive data set that I've been working on putting together. And these are individual level personnel records of almost all public employees across 20 different US states. And so what I did was I went state by state, and via public records requests, I've collected rosters of everybody who works in the state bureaucracy. And so at baseline, these files include employees' names, their job titles, the agencies that they work in, and their salaries. And it also often contains information about their race, their sex, the county that they work in, and in a handful of cases, their age. And so I've taken all this together, I've cleaned it, I've compiled it, which is a lengthy process I can talk about more later, because all of it is coming from different sources, different software systems. Every state has different processes for collecting this information. And the resulting data set is this data set of about 1.7 million unique state employees. The data is also longitudinal. It's snapshots over time. And so it's about just over 40 million observations where the unit of analysis is the employee period. And so with this data in hand, I've merged it with voter registration records. So these are individual level records of all voters in the United States partisan affiliation, so the partisanship that they use to register to vote. I've matched that with these state bureaucrats' records to try to get individual level measures of these employees' partisan affiliations. And I could talk about these merges for 3 hours, so I'm not going to do that. I'm happy to talk about it more in Q&A, but for now, I'm just going to say that I was able to successfully match about 72% of my state employees with voter registration records. And this is pretty similar to other recent attempts to match, for instance, federal employees to voter records, as well as police officers around the country to voter records. So here are the 20 states in blue that I have data on. I can talk more in Q&A about the 30 states that I don't have data on, but you'll see that the sample I do have has a lot of regional variation, as well as a lot of variation in the partisan control of state government. So the first thing I mentioned off the top was whether the state bureaucracies are even really ripe for political targeting. And so off the top here, we think that like if political targeting does exist, it's likely to only affect certain types of bureaucrats. A governor looking to refashion the bureaucracy to contain more people with policy views similar to themselves is probably not interested in the ideology of the mechanics fixing cars in the state patrol fleet. They're likely also probably don't care about the partisanship of nurses and doctors working in the state hospital. Instead, they're probably interested in those employees who have power over bureaucratic outputs like regulations, budgets, and policy. And these are the employees we'd think where we might be able to find some evidence of targeting. And so now it's hard to identify who these bureaucrats are. At the federal level, we have these really nice, well-defined types of bureaucrats. We have the senior executive service that we know is very influential and is easily defined by by the classification system in the federal bureaucracy. We don't have that at the state level, and we definitely don't have that in a systematic way across 20 different states. And so I'm going to try to identify these powerful employees using this two-pronged approach. And so first, I think it's fair to think that salary and influence are likely positively correlated with one another. So what I first do is I subset, well, first I take a snapshot in time. I'm going to show you data from just a snapshot from early 2021. And then I filter down the data to only include those employees in the top quartile of salary for their state. That includes a lot of false positives, though. There's a lot of doctors, nurses, engineers, people who make a lot of money, but aren't really influencing public policy regulations, outputs that we're interested in. So I also then go through and drop employees with job titles who contain words like psychiatrist, nurse, doctor, engineer. And so now I'm going to show you just the partisan breakdown of that senior group of employees by state. And so the horizontal axis is going to show you the share of that group that's registered Democrats. The vertical axis is going to be the share of that group that's registered Republicans. And the state abbreviations that are about to pop up that are in red are going to indicate that that state has been under solid Republican control at the gubernatorial and legislative levels since 2017. And so the first thing I want to point out here is just looking at the horizontal axis. we see, I think, some things that are really interesting. So we see some states where Democrats have had a lot of success at the state level. Vermont and Washington, for instance, where there's a lot of Democrats working in these senior positions. But after that, it's a lot of very Republican-dominated states that have a lot of Democrats in their senior echelons of their state workforce. So states like South Carolina, Texas, Arkansas, and Iowa all have more Democrats in this senior echelon than states that have seen a lot more success, than states where Democrats have seen a lot more success at the state level, states like Minnesota and Massachusetts. And so likewise, if we look at this dashed line here, states that are below that line are going to have disproportionately more Democrats in this senior echelon than Republicans. And likewise, we see states like Florida, Texas, Arkansas, and Iowa that all have more Democrats in this senior echelon than Republicans. And so I think this kind of sets, provides some interesting descriptive evidence that at least the preconditions for political targeting exist. There are Democrats in influential positions within very Republican-dominated.
This is the Levin Center, is it?
Oh. It is the Levin Center for whoever just asked. Okay, so that kind of sets the answer for that first question I mentioned. The second one here is whether, given that we do know that there are Democrats in positions of power, are these Democrats targeted, are political opponents targeted following the removal of civil service protections once it becomes a lot easier to remove them from the workforce? So I'm going to focus on this specific case of Mississippi. I gave you a little bit of a preview of this with this anecdote about Mississippi Department of Marine Resources. That is one of a number of different state agencies that Mississippi has temporarily removed from having to play by the civil service rules since 1988. This is this really unique case that I haven't found in other states of these temporary exemptions from the state's merit system. So between 2014 and 2020, 5 agencies were temporarily exempted. In addition to marine resources, corrections, human services, education, and child protection services were all exempted from a period of about 6 months to 2 years, depending on the agency. And all agency employees in this period were treated at will. They could be fired and didn't have the ability to appeal their terminations during this exemption period. And then after this exemption period finishes up, agencies were folded right back into the merit system and civil service protections were reinstated. And as with the story of marine resources, these exemptions usually followed agency scandals or significant policy failures. So the Department of Corrections was exempted after the commissioner of the agency was indicted on taking kickbacks on hundreds of millions of dollars worth of grants. The human services and child protection services were exempted actually via a court order because of failures to protect children in foster care. And the Department of Education was also exempted due to concerns over the performance of the agency. So the first thing within this case study in Mississippi I'm going to look at is, once all of these employees lost their protections, did involuntary dismissals increase? So the specific outcome I'm looking at here is whether the share of employees in these agencies, whether the share of employees in these agencies who were involuntarily dismissed increased. And so this is specifically looking at terminations. We're not looking at resignations. We're not looking at retirements. We're not looking at deaths. Just people who were fired is the outcome in a 6-month period. I'm going to do this with 3 separate synthetic control models. I'll talk about why it's 3 in a second. These models, what we're interested in doing here is creating a version of the exempted agency that looks very similar on a number of different observed variables, like its size, how many employees work in the state capital, as well as pre-exemption departure rates. We want to make an agency that looks very similar to the exempted agency on these variables. But the key thing here is that this control agency never experienced the exemption. And so by comparing our observed value, our observed shares of involuntary dismissals to this artificially created version of the agency, we can get a sense of the treatment effect of these reclassification policies on involuntary dismissals. And data constraints are going to limit my analysis to just 3 agencies here. I can talk about that more in the Q&A. So here are the 3 agencies: Marine Resources, Human Services, and Education. I run all these models separately. This red shaded area is going to be the time period where the agency was exempted. And so what you're going to see, you're going to see a blue line. That's the observed share of employees who were involuntarily dismissed within the 6-month period. The yellow line is going to be this statistical control to kind of get a sense of how large these treatment effects are. And we see across the board large increases in involuntary dismissals. So about at least 5 percentage point increases in involuntary dismissals following in the 6-month period following reclassification. And if we put these in terms of pre-treatment dismissal rates, these are massive effects. These are 2-3 times larger than average pre-treatment dismissal rates, indicating that these policies led to large numbers of employees being removed from these agencies. But what we're really interested in is, who are these employees being removed? And in particular, in this case, are Democrats, since Mississippi is such a Republican-dominated state at the state level, are Democratic employees in these state agencies going to be targeted for removal following reclassification? And so here I'm going to use this individual level survival analysis, and I'm going to look in particular at the outcome variable of, did an employee depart the state workforce in a given month? And what I'm interested in is whether, following the removal of civil service protections, do we see a divergence in the frequency of Democratic and Republican employees departing these agencies? And so if political targeting does exist, we should see Democrats being more likely to depart following reclassification than Republicans. And I'm going to do this with this Cox regression model, which is kind of this like workhorse and survival analysis. And I've also weighted the data to take into account the differences between Democrats and Republicans on observed variables. So I run these models separately. The highlighted row here is going to be this key coefficient of interest, the interaction between, are you a Democrat and did you leave after reclassification? And what we see is actually the opposite of what we'd expect if reclassification leads to political targeting. I'm still trying to figure out exactly why the coefficients are negative here. This is actually indicating that Democrats were less likely to leave than Republicans after reclassification. And these are the coefficients are logged hazard ratios, but if we exponentiate them, we get this easier to grasp result, which is that in corrections and education, for instance, Democrats were 23% and 45% respectively less likely to depart the state workforce. So finishing up here, I think it's important to note that it's difficult and it's costly for if agency leaders, if a governor is interested in targeting political opponents for removal, it's really hard to do that. Even when it becomes easier to focus, even when it becomes less costly to remove employees. It might be hard to figure out who those opposing employees are. And then because they might be unwilling to really share their views in the workplace. But I also don't think that that means that this is a completely apolitical process, because we can definitely think of cases where reclassification is a means to remove opponents from the bureaucracy, but it's going to be much more of a blunt tool than a scalpel for doing so. And so what we might expect to see is targeting of a specific agency, a specific class of employees, removing their protections, and then letting this personnel management process kind of play itself out, increasing dismissals from the agency, and maybe providing opportunities for governors to fill that agency with more people who have similar policy views. And I just want to close here by just pointing out that I think there's a lot of exciting different ways to go with this study of removing civil service protections, looking at how it affects things like compensation, hiring, how it affects bureaucrats' performance on the job, and probably most excitingly, what are the downstream consequences of these sorts of policies on outcomes that we care about. Thank you very much.
Thanks, Benjamin. At this time, I will turn the floor over to Ted Booth for the practitioner review. Ted?
Hear me?
Hear you loud and clear.
Good. Very good, very good. Thank you very much for this opportunity, and I really enjoyed reading Benjamin's article, and I think it was extremely well done. I think he had a very rigorous methodology, and as a practitioner of 40 years standing, I can tell you that this is of value to me. It seems like almost for my entire career, we have been watching agencies operate under these personnel board holidays, as we call them around here, dating back to 1988, when we went through a legislatively mandated reorganization of our Department of Economic Development and took state service, which is our civil service protections, away from all of their employees. And ever since that happened, people in our legislature have asked our staff or others, what really motivated their decision to terminate X, Y, and Z in this particular agency? And there's some people who had often asked the question, well, was there a political motivation? And I think Benjamin's research gives me an answer that I can tell people that at least in the cases that he has evaluated, there was not a partisan purpose for terminating certain people. Now, historically, we have heard agencies tell the legislature when they've been advocating for these things, we think these personnel board exemptions will make our agency more efficient or more effective. And one of the frustrating things that we have had to deal with over the years is that the agencies never define their terms. They never set out the metrics necessary to establish what they had ultimately achieved through their reorganizations and their terminations. And over the past several years, we were able to successfully advocate the passage of some new legislation that will actually require agencies to set out what they intend to accomplish, how they think the changes will increase, say, their outcomes or outputs from getting a personnel board holiday, if you will. But as I say, many people have asked the question, was there a political motivation? And I think now I can tell people, at least based on this research, we can say that when someone looked at the question respecting several agencies, they determined that there wasn't a political motivation. I think Benjamin has some excellent discussion points that he brought out that people should follow up on in the future. While terminations may not have been politically motivated, what about compensation decisions? What about hiring decisions? When you fire a person and you bring someone in, will that person be making more money than the person who was terminated? When somebody is promoted under these conditions of a personnel board holiday, what salary will they be receiving? And were there some motivations for compensating them that were political? And that creates a research opportunity for somebody else on another day. And I would love to see somebody look at these same agencies and see if they can come up with a conclusion regarding terminations, rather hiring and compensation decisions, which mirror the research that Benjamin did on terminations. I would love to see if one can find political motivation in the compensation and hiring decisions. But I found this very interesting. I will keep a copy of this report around. We haven't done a personnel board holiday in the past several years, but I'm sure I will see another one come up in the legislature before I retire. And I will have this research sitting here in my office to share with folks if questions arise regarding motivations.
Thanks, Ted.
Yeah.
Thank you, Ted.
Sure.
And this time I'm going to swing over to a little bit of a Q&A session here. I see that we have some questions in the Q&A shoot here from State Representative from New Hampshire, Jordan Ulrey, I believe. And the first question was a question that I also put down in my notes. Benjamin, I was curious to hear a little bit more about this Republican states being more likely to remove job protections and these sort of things. Can we just tell us more, kind of thing?
Yeah, so I think theoretically it's not necessarily the case that it just has to be Republicans. I think both Democrats and Republicans historically have found themselves frustrated with career employees at different points in time. So it's not necessarily that this is just a Republican phenomenon, but in the last 30 years, at the state level especially, this has been happening in Republican-controlled states. So two of the largest reforms happened in Georgia and Florida in 2001. More recently, in addition to this case of Mississippi, we have similar policies happening in states like Indiana, Missouri, Arizona. I just saw an article that Louisiana is trying to change their constitution to be able to to remove some protections for employees in that state as well. So it's definitely not that this is a unique phenomenon to Republicans. Again, there's lots of evidence, especially if we go up to the federal level, of Democratic presidents being upset with civil servants after they come into office. That is not unique to a specific partisanship. But empirically, what we do see is that this has been happening more frequently in Republican states.
If I could interject something right now, if we mentioned the very first one we experienced in Mississippi was in 1988 involving our Department of Economic Development. At that time, the governor was a Democrat and the legislature had Democratic supermajorities in Mississippi in both houses. And when I say supermajorities, I mean, I think we had 4 Republican senators out of 52, the rest Democrats. And in the House, we had maybe 7 or 8 Republicans out of 122. And that was a sweeping reorganization, and lots of people were terminated. So once again, I know Benjamin didn't study that, but that's a good example of a case where it happened in an overwhelmingly Democratic administration.
Yes. Thank you, Ted. Yeah, that's a great point.
Yeah.
And one other question that I had, I was thinking about the just the departments and agencies that were picked in Mississippi. Do we know a little bit more, just kind of, sort of behind the curtain, why these particular ones were picked or why other ones were spared?
Yeah, so that's a great question. And Ted might be able to shed more light on this than I can. So I think this study is very much so not about the decision to remove protections. This study is very much so more focused on, once protections are removed, are executives exploiting that opportunity? And the tricky thing is we see, so these agencies that were exempted, it's tough to know the kind of the denominator, the number of other agencies that maybe could have been exempted over the last 30 years, but weren't, to try to get a sense of like, why are some agencies being exempted and others aren't? So it's tough to analyze that, really. It is anecdotally, it seems pretty clear that the given reason, at least, that these agencies are being exempted is because they really screwed up. Like somebody did something really wrong, and the state government's trying to fix that. And so what I'm trying to get at is whether they're also using that as this opportunity to refashion the makeup of the bureaucracy. But it's tough to systematically test like which agencies are being exempted and which aren't, without this clear sense of like, what are all of the possible agencies that could be exempted?
Yeah. And then also in the Q&A, oh wait, Marjorie has her hand up. Marjorie? Oh, maybe she just has her hand up. Okay.
No, I actually was trying to, for some reason I can't type in the Q&A. And one of the things that I was curious about was given the history of the Democratic Party in a state like Mississippi, what's the date of when those voter registrations identify somebody's party? Because I can envision that there's some folks that in Michigan we would call very arch conservative folks who are registered as Democrats, and it might be sort of helpful to at least discuss that possibility given the history of Mississippi's Democratic Party.
Yep. So the voter registration records I'm using here are, so in Mississippi, I have monthly data from about 2010 to 2022, and I match that personnel data with 3 different copies of Mississippi voter data. And within each of those voter registration data sets, partisanship in Mississippi is measured as the most recent, I believe most recent even year political primary that you participated in. So Mississippi is not a state where you register to vote under a certain partisanship. That's what like a plurality of states do that, maybe even a majority of states do that. Mississippi doesn't, but it does have partisan primaries. And so this data set that I'm looking at measures all voters' partisanship based on their most recent primary that they participated in. So while there is definitely differences between Democrats in different parts of the country, this is picking up on contemporary measures of individuals' partisanship rather than something more historical.
Great, thank you.
Yeah, thank you.
You know, I see another question also from Robert Oldham has his hand up. Rob, you with us?
Yeah, I just wanted to follow up on that point because I had the same question. I know this has come up in the DC data when we try to measure like lobbyist partisanship. So I wanted to see if you had any thoughts on Mississippi. Do you know, are a lot of these workers based in Jackson because they're working for the state government? And if so, does that potentially affect what primary they're voting in because they actually just want to vote in the Democratic primary regardless of their underlying partisanship? Because that's like the election that matters for Jackson more so than if they lived in another part of Mississippi.
Yeah, so I need to. That's a good point. I need to look at that more. I think so kind of 2 questions I see. First is like the distribution of these state employees across the state. I haven't looked at, I need to look at this a bit more systematically, but like much like at the federal level where most federal employees are not in DC, as far as I can tell, that's a pretty similar case at the state level. So you're going to see definitely a big positive correlation between like the population of the county and the number of state employees. And while there are more state employees in Jackson, I don't think it's not a severe difference, but I will look at that more. The second question, I think like the strategic voting side of things, it's definitely a possibility. I think I don't have the site off the top of my head, but I know there's some work out there that's suggested that that's pretty minimal and on the margins. But I do need to look at that as well. Yeah, thanks, Rob.
Next question I see is, you know, somebody that's been a great friend of the Oversight Academy for many years now, Dan Johnson, coming from Evan from Idaho. Are these changes simply being made because of political affiliations or because employees bring politics into the workplace? I've worked successfully with both major parties as a former legislator.
Mm-hmm. Yeah, absolutely. Thanks, Dan. So I think, are these because of political affiliations or because employees bring politics into the workplace? So Dan, I think I would say that when this does happen, it's probably more likely to happen because of disagreements over policy rather than some sort of like patronage type setup where I want to get Republicans or Democrats jobs. Like it could be either one. I think in terms of your different options here, I think it would be employees perhaps bringing their personal views into the workplace and shaping the jobs that they do. So there's a lot of work out there at the federal level that like the ideology of an agency, for instance, is going to impact how it does its job, how it interacts with presidents from different parties. And so we think that that does matter, at least on the margins, about how these employees are going to operate. But that doesn't mean that obviously I'm not going to tell you that that's like the main factor motivating how these employees are doing their jobs. I think there's many other considerations that are probably more impactful, but I do think this is one that again might impact things on the margins, and also just hasn't been studied at all at the state level. And so it's worthwhile to dig into it a bit more. But yes, I definitely agree that like you've worked with both major parties, and like I think a lot of these a lot of folks from most of these states would say something similar. But I do think it's still worthwhile to dig into whether there are cases where this might affect things.
Well, and Benjamin, I have another question here that I've been kind of thinking about with particularly with the Mississippi example. And Ted, feel free to,
Sure.
I'm being unfair on, kind of the way
That's all right.
it looks like these particular agencies, they were targeted. There was either gross ineffectiveness, or there was a scandal. There was something that led to leadership in the state saying we need to take action.
Yep.
Comparing it to other types of reclassification efforts that have happened in other states, is there any sort of opportunity for a comparative analysis of just looking at the type of personnel changes that happen when it's in response to something bad, a big screw up, versus more of a like just political philosophy, big picture? I'm worried about the creeping influence of the deep state, so I'm going to cut it back. Like more of the like routine type of like maintenance of the workforce type of conversations versus response to something bad. Has there been any examination there?
So I think at the state level, these have mostly been happening due to concerns over the quality of government. And it's very much so been pitched as this means of like, let's make government work better. And this is one approach of many to possibly do that. And so I think they kind of fall within a similar set, where maybe these instances from Mississippi are a bit more extreme. But even the other ones that have happened at the state level are kind of in a similar genre of let's try to improve the quality of government. Now, I'm working on another paper where I'm looking at similar things in a different case, which is in Florida, where they exempted all senior state employees in 2001, and seeing whether that. So that is in the works. I think the tricky thing is trying to, and I'm hesitant to do this too much, is to take this case and try to use it to understand the potential effects of something that happens at the federal level, because the rhetoric around removing protections at the federal level is, while you do see that improving the quality of government, there is also an explicit like, let's try to remove enemies from the government. And so that seems a little different. And I think it's tough to extrapolate from this case to that case. I do think, though, that there is something to be said of my findings of the lack of targeting, that at the federal level, for instance, maybe we won't see any individual level targeting. Instead, we're going to see the targeting of a senior echelon that is perceived to be have different views than the president.
Yeah.
And even if there isn't any targeting within that group, if removing their protections means that a ton of them are going to leave, President Trump, for instance, might be fine with that. Maybe he loses some allies in the process, but he doesn't have to individually target people he disagrees with if he removes protections in the same or en masse. Yeah.
Thank you both. And last question, and I believe we might be needing to move on to the next presentation here. So from also from Rep. Goehring, is reclassification a result of economic factors or political factors?
Yeah. So like this paper is I'm really looking at once reclassification, what's the impact here? I think it's a separate question looking at why reclassification is used. There's a number of different, we're talking about oversight today. There's a number of different ways that executives, legislatures can oversee the bureaucracy. And this is one of many tools. And so this is slightly separate from, I think, that question. There has been some work done on the why reclassification happens and not other policy changes. Someone named Robert McGrath at George Mason has done some work on that, and he emphasizes the political factors. But I'm kind of trying to focus more on once it happens, what are the outcomes? Yeah, thank you.
Great. And then Marjorie, I know you had your hand up. We have enough time for another follow-up question from you if you're still on. Otherwise, we'll move on.
I am. I actually had a sort of somewhat related question to this, what's the motivation for the exemption? And it ties in with your decision not to include the MDs, because they would potentially be not so partisan. But in the era of abortion politics and all sorts of health issues, I could envision some of those folks in the public health agencies being targeted deliberately. And I'm wondering if maybe environment, public health, sort of a selection of agencies, if you could look to see, sort of the politics behind that, the interest group activity out there that might be pushing the legislature to do that.
Could I point out something on the MDs right now? MDs under our state personnel board law fit within the definition of non-state service employees, like legislative employees and attorneys. They don't have civil service protection anyway.
Yeah. Yeah, and other states they do, so that the front end thing. So yes, Ted, I'm with you on that point. I think yeah, thanks, Marjorie. I think there's definitely at the end of the day, it's really challenging to try to do something like define an influential bureaucrat across 20 different states. And so this is a first crack at it. And I think, at least for now, I think I'm interested in, because of a lot of work that's happened at the federal level, I'm interested in people impacting regulations, policy, budgets, those sorts of employees. I agree, though, that there's room for other for politics to maybe affect how other types of people do their jobs. And I think that's like a great avenue for future research. I'm working on some other projects. I have a ton of data on correctional officers, for instance, because of this, as well as public health employees, like you mentioned. So I am working on that, but I think it might be slightly different than what I'm getting at here. Yeah, thank you.
Well, thank you both. Benjamin, fascinating paper. Ted, thank you for a great review. Really appreciate both of you kicking us off and a great start for the symposium. At this time, I'm going to be transitioning over to Ian McKnight for the second paper. Ian, the floor is yours.
Excellent. Thank you very much, Ben. Good morning. I'm Ian McKnight. I work with Ben at the State Oversight Academy. And as a former legislative staffer who has spent years thinking about casework, it is my absolute pleasure to introduce our next grouping to you. Megan Rickman Blackwood is a PhD student at the University of North Carolina, Chapel Hill. She just earned her master's in political science and is going on to pursue her PhD. Before starting her graduate work, she served as a legislative director for Senator Mamie E. Locke in the Virginia State Senate, which inspired her to center her research agenda on creating knowledge to inform equitable policymaking and representation at the state level. She works on discovering ways for legislators to bridge access gaps and presents data-driven strategies for creating more inclusive government. Megan will be presenting her paper on proactive casework theory, and then she'll be joined for a discussion by Margaret Buck. Margaret has worked as a legislative aide in Nebraska's unicameral legislature for 22 years and 4 different senators. She has a bachelor's degree in journalism and mass communication from Kansas State University, and her career has taken her from small town newspapers to the United States Senate and on to the Nebraska Unicam. For the last 3 years, she's worked for Senator Michaela Cavanaugh, who is, and I'm quoting from the provided bio here, the filibuster queen of Nebraska. I am so pleased to bring both of you together for this great discussion today. Megan, I'll let you take it away.
Okay, thank you so much, Ian. I'm just thrilled to be here and thrilled to be having this conversation. And I'm already immensely fond of Margaret, so I'm excited for us to have a conversation. All right, I'm going to go ahead and share my screen, and we're going to jump right in. Okay, so today we're going to start with just a really simple question. Do you think the system of democracy in the United States is working or not? In a March 2024 Quinnipiac University poll, 49% of registered voters said no. Trust in institutions created to serve the needs of the whole has fallen to drastic lows. A recent Pew survey found only 8% of respondents reported high or moderate trust in Congress. And then if we exit our bubble of focusing only on American politics and government and turn to established theories from our comparativist colleagues who study the world at large, alarm bells really should be ringing across scholars and practitioners alike. In Haggard and Kaufman's 2021 Anatomy of Democratic Backsliding, lack of trust in institutions is one of the first symptoms of a failing body politic. American democracy is at risk and in danger. So I want to just situate this argument and be very clear. There's many lofty academic definitions of democracy, but today what we're talking about is what I like to colloquially refer to as like Gettysburg Address democracy, right? A government of the people, by the people, for the people. In short, it's a social contract where we, the people, through our continued belief and participation in elections, empower a system in which representatives are selected to serve at the will of the people, to enact legislation, and then also, importantly, to oversee bureaucratic agencies that deliver common goods. Now, within this process, there's a million steps along the way where a lack of trust, knowledge, efficacy, or approval threatens to undermine this sacred but precarious contract. And scholars across the discipline are grappling with grand theories to understand our situation from a 1,000-mile view. But today, I want to narrow in and focus on one small part of the process that I genuinely believe can serve to improve overall positive feelings about the government and elected officials in a really personal way. And what I'm going to argue about today is changing the directionality of the provision of constituent services. So constituent services, frequently referred to as casework, is an often overlooked but important part of an elected official's duties and a prominent way that elected officials can offer evidence of a functioning government by serving as an advocate for constituents experiencing issues with state agencies. Now, as most of our practitioners here could tell you, and I can tell you from experience, the traditional way this works is what I'm referring to as the reactive casework model, or RCM for short. And in this role, the constituent is responsible for being the first mover. They have to reach out to their representative either through a phone call, an email, visiting their website, and tell them about their problem. And only then does the advocacy process begin. But this model requires a lot of the constituent. They must have enough political knowledge to know that their representative can serve them in this way, and then also how to contact them. They must possess enough trust in their representative and the system to believe that if they do make contact, there's going to be any meaningful assistance. And then also they must be efficacious enough to pick up the phone or send an email. And here this just means like believing in yourself enough that like, I can do this thing. It's not too hard for me, right? And scholars of political science have spent decades trying to better understand who participates and why. And there's much work to do regarding contact for the specific purposes of constituent services. Not a lot of people have studied. They'll ask, have you contacted your representative? But there's no follow-up of like, well, what was it for? Was it about policy? Was it, for casework? So there's a lot of room here to look into the type of people that are going to be participating in this way. However, based on what we do know about participation, we can use that to inform some assumptions about who would make contact to request casework. So the socioeconomic status model has long shown that a voter's level of education, income, and their occupation are some of the most stable participatory determinants of their political participation. Verba, Schlossman, and Brady, along with Kim and Nye, they've conducted some of the most extensive work here, and they are the one study, to my knowledge, that is asked specifically about contacting for casework, what they refer to as particularized contact. Now, Verba et al. Have also extended those SES predictors to include considerations for resources available to the constituent. So here they're arguing that access to things like time and then learned civic skills that you acquire through memberships in organizations like churches or unions are necessary for voters to be able to meaningfully participate, particularly when they're trying to navigate the hierarchical systems of like bureaucracies and state agencies. Motivation models can also inform a lot of our assumptions about what conditions would be necessary to activate participation to seek casework. And there's some arguments about how these can come through mechanisms like pain loss events. This was seen during the AIDS epidemic, and we're also seeing this now with a lot of young people activating around gun policy, gun safety issues. And then also it can come through direct experience with ineffectual agencies. I highly recommend Jamila Michener's book, Fragmented Democracy. She does an extensive study of recipients of Medicaid and sees that when you do interact with an agency that is not working for you, you kind of get to that last resort and you reach out to somebody, and that's how they interact with the agency. And anybody that's worked the phone in any of these districts and worked casework can tell you this motivation mechanism is particularly prevalent. Anecdotally, in my own time working in the Virginia State Senate, I often spoke to individuals who were, for a lack of a better term, like at the end of their rope. And most often than not, prior to the email or call, they weren't aware that this type of advocacy or oversight was available through their representative. They'd kind of reached out as a last resort. So given our better understanding of the assumptions about who we can expect to request assistance from the elected official when needed, we turn back to the model that we see under the RCM. And we know that the majority of the citizenry does not possess the skills needed to navigate this system. So Steve Rogers finds that Americans possess little knowledge about who represents them in their state legislature or the agencies meant to serve them. Further analysis proves this information isn't easily accessible. I conducted a survey of all 100 websites for the Virginia House of Delegate members serving during the 2022-2023 session, and only 25% mentioned constituent services at all on their website, with only 8% providing specific information on how the constituent could get help. So just to situate this, in Virginia, each delegate represents roughly 84,000 people. This means that for 92% of Virginians, if they were experiencing a problem with the state agency and knew they could turn to their rep's website, or they kind of reached that proverbial end of the rope and Googled and got there, zero information would be available about how to submit a casework request for roughly 7.7 million Virginians. So we also know that Black and Latino voters continue to be overrepresented among the least politically informed. This reflects persistent and systemic knowledge gaps between whites and non-whites. And we also see those same gaps in efficacy. And that's just not only among minority populations, but also women who report feeling less efficacious than similarly situated men. And we've already discussed some of the troubling findings that we've had around trust. So under our current system, the failure of certain groups to participate in this way and to be able to seek out assistance in casework when they need it, it shouldn't only be expected that they don't participate, but also accepted as a rational response to their lived experience. Abramson's political reality model tells us that in a political system characterized by majority rule, minorities realize that they have little political power, and they respond to this reality by exhibiting negative political attitudes and expecting little political representation from the system. So if we're looking at casework as a means of restoring trust, as I believe it can be, the literature so far suggests that the traditional means of contact leave many constituents behind. To test this theory, I conducted a meta-analysis analysis of all available data from Pew Research Center over the last decade, containing surveys that asked respondents if they'd ever contacted an elected official. Additionally, as a preliminary measure to test the trust, efficacy, and motivation assumptions, I aggravated any of the surveys that contained the specific question: if you were to contact an elected official, how likely would they be to help, with response options ranging from not likely at all to very likely. While I don't have time to deep dive here, but I'm happy to share with anybody, all assumptions really perform as expected under the RCM. Those high in our measures of institutional and governmental trust, those high in political knowledge, and those in the highest income brackets both contacted their reps more frequently, and then also reported higher levels of trust that any contact with the representative would result in meaningful action. We'll just look at a quick one here. This is reported contact with an elected official. These are, again, the averages over all the ones that I could find that had this. As expected, the higher the reported income of the respondent, the more likely it was that they would have reported having contact with an elected official in the last 5 years. And okay, so I know that was a deep dive, and I appreciate all of you sticking with me as we went through the weeds there, but I really think it's vital to understand that under the provision under the RCM really does set a high bar for participation that a lot of voters just don't meet. And now, even if we do have a voter that kind of gets over all of those hurdles, they know enough, they're motivated enough, we also can run into some problems on the other end with the representative. So standing work has found that representatives are more likely to advocate on behalf of co-partisans. They also have been found to favor high-income constituents over low-income constituents. Kalla and Brockman uncovered that senior policymakers made themselves available between 3 and 4 times more often when informed that the constituent requesting a meeting was a political donor. We also know that representatives have been shown to favor constituent services that benefit those with whom they share descriptive characteristics. Gross et al. Finds that without existing networks within marginalized communities, representatives are rarely motivated to reach underserved constituents. And now, just to be clear, I do not want to be discouraging or disparaging. I know a lot of you are in the trenches doing this work every day. Scholarly work has discovered that there are officials that choose to prioritize casework either for electoral reasons or as like a perceived obligation or moral duty of office. Work has found that women, Democrat, Black officials, and those in electorally unsafe districts focus more of their office's attention, both staffing and funding, on casework. And I know that there are some amazing offices and teams out there that are dedicating ample time and resources to casework. But what I'm hoping to show you here is that under the reactive model, given what we now know, even the most dedicated representative or caseworker would never see the true distribution of need in the district. So this graph is simulating the given need for a district. So as we've discussed already, in order for a constituent to rationally choose to be the first mover under the reactive casework model and reach out for help, they need to either have the appropriate level of any of our participation predictors or the appropriate level of motivation. So here you can imagine on the x-axis, like any of our participation predictors, here I'm using political knowledge. And to create this distribution, I used Steve Rogers' findings that 8% of people could name their state legislator. And I relaxed it a little bit to include the 14% of respondents who could name their House of Representative reps, just to make sure we had a little bit more distribution there. Because my assumption was that if they reached their House of Representative rep and it was a state level issue, they would eventually find their way. So anything on that higher end is somebody that knows one of those. Then if we look on the y-axis, we're looking at the motivation model here. And this is being operationalized by considering whether or not the request has anything to do with housing, nutritional, or income needs of the individual. And I want to be really clear here that this is not operationalized to account only for the most at need, right? If you are having trouble with the operational, like the process to submit an RFP for $1 million state grant, and the job will hypothetically make up 75% of all your revenue for the next year, that's considered a pretty high motivating factor in that income category. By no means am I trying to say let's reach the underserved and ignore the other population. What I'm hoping to say is we can reach everybody if we change the way we do this. So turning back to this graph for demonstration's sake, let's say that the barrier is a 7 or higher on political knowledge and a 7 or higher on motivation. So everyone here on this graph that's below the red line would get left behind. Even the most dedicated representative who spent every available resource on casework would never get a true picture of the need in their district under the RCM. So situated amongst our initial puzzle, RCM doesn't seem to really solve the problem. So how do we use casework to restore trust among the population? Today, I would like to present what I like to refer to as proactive casework theory. Now, under PCT, we're just switching the roles, and the representative takes on the role of the first mover. Now, using existing campaign software like Ready Mode or eCanvasser that randomly dials vetted lists of constituents in the district, this is typically used for mobilization or fundraising efforts. The representative can activate volunteer networks, use that same software, and contact constituents throughout the year and just check in. Under PCT, volunteers ask 2 simple questions. Are you experiencing any issues with state agencies? And if so, how can we help? In partnership with the Office of Delegate Sam Rasool in Virginia's 38th House District, we were able to conduct a pilot of PCT. So we collected data for requests using the PCT model for a 3-month period in 2023. And then we compared that to observations that had been collected by the office during that same period in 2022. Now, observations under the RCM resulted in 31 contacts with constituents, and 28 of those were actual requests for services. Under the PCT, the same 3-month period of study resulted in 1,728 contacts with constituents with 1,006 requests for services. So this represents roughly a 5,474% increase in contact with constituents with a 25% increase in requests per contact. So this reflects that massive distance between the representative's perceived need for services in the district and what's actually out there if we were just to ask people if they needed some help. So to test some more of the assumptions under the PCT, particularly one that it was going to result in larger proportion of service requests reaching typically underserved people. Requests were categorized by type of request or associated agency. Then they were assigned a more specific subcategory if applicable. And then I additionally used the notes that were made by the volunteer for each call to further classify each request as either marginalized, privileged, or neutral. And just as an example of how that worked, for 2 different service requests under the PCT pilot, they were both initially coded as housing. But when I looked into the notes from the volunteers, one constituent needed help navigating the Virginia HUD complaint system for a derelict property that had rodents and mice and was not being responded to. That is going to be obviously categorized under the marginalized classification. Another constituent during this period reached out because they were having trouble getting the sheriff to initiate an eviction. They were a landlord and a tenant had fallen behind on rent. So this is going to fall into that privileged category. Most of the neutral stuff was education or DMV. It's hard to say what type of situation someone's in if they're just trying to get a license renewed, right? So to be safe, those stayed into the neutral category, and then anything that didn't have enough notes to be classified went into neutral as well. So under the RCM, 53.6% of all service requests represented underserved populations. Under the PCT, this increases to 78.1% of all service requests. So I know we have, I'm going to try to be quick because I'm getting close to the end of my time, but I know we have caseworkers and representatives in the room, and I know you're probably spinning right now, imagining the extra hours and staff it would take to transition to this proactive model. So just some quick assurances. Again, you could use the volunteers to make a call, and then if you're thinking on the back end about how do we respond to all these requests, this is some data from the PCT. 18% of all calls required no assistance. Of these, only 2% were noted as being angry or being asked to be recalled from removed from the call list. Additionally, 11% were able to be immediately sent up to the federal level. Building partnerships with the House and Senate reps for your district is crucial. As a note, there's a really good program going on with PopVox right now where they're trying to streamline this system. So please get in touch if this is an issue you had in your office. Another 5% of all calls just wanted to discuss policy when they were given the chance to directly speak with someone from the representative's office. And of this, I know a concern I've heard is like, well, it'll be a big waste of time, but only 8% resulted in a voicemail that was never returned. Additionally, one of the things that I think is going to be really important for PCT to be able to be successful in people's district is being able to be in partnership with non-governmental organizations that can help particularly when people are calling about means-tested services that they may not be able to, they don't qualify for food stamps, but they don't make enough money to pay rent and get food, right? Delegate Rasul's office is really good about partnering with their local organizations. So 12% of these calls were also able to be outsourced to either mutual aid or some sort of NGO in the area. So overall, that was roughly 50% of all contact that did not result in any additional work for the office other than just passing off the information or calling another office on behalf of that person. Real quick, I'm just gonna run through the last ones and then we could go back to them if you want, but I don't wanna take too much time. But I've spent a lot of time talking about how this is beneficial for the constituent, but there is significant benefits to the representative as well. Name recognition is huge. You're calling them, it's unusual. It's something that's going to stick. Traditionally, when we are seeing citizens receive calls, it's donations. We're trying to get you to come out and vote. Somebody calling and just asking you if you need anything is huge. And we did see a large portion of people just excited to get a call. Additionally, thinking about their network and if they tell people about it, things like that. It also is a really good opportunity, especially as we're talking about this here at Levin, to subsidize oversight. We know the Cox and McCubbin kind of like police patrol versus fire alarm. PCT is installing a fire alarm in every person's house in your district. And more importantly, you're encouraging them and empowering them to pull it when they need to. We have also seen increased approval. There is one survey that finds that even including the information about a sitting senator doing casework increases their approval among the opposing party by 9 points. And also you're extending your networks, right? We're reaching out past the people that we would traditionally interact with, which can be extended for all the other things that we are doing in the offices and that you guys are doing in your offices. Thank you for your time. I'm sorry, I rushed through the end because I didn't want to go over too much. Thank you so much for your time. I have tons more stuff if anybody wants specifics. There's also information about how you can get involved either by running a PCT pilot in your office or just talking with me more about what casework has looked like for you and your office. Thank you guys so much for your time. I really appreciate it.
Thank you so much, Megan. That was excellent. And now we'll move on to our practitioner review portion, and that'll be you, Margaret. So please take it away.
Hi, everybody. Thanks for joining the webinar today. I have been doing constituent casework in Nebraska for 22 years, and over that time, I've seen huge changes in how that's been done and the challenges that have been presented to us as staffers to get information for a constituent. I used to be able to call up a state employee in a different department and talk to them. Today, that's not so much the case. Today, everything is controlled through the Governor's Policy Research Office and has to be approved before they talk to us, either on a policy basis or on a constituent basis. And a lot of times now when I ask for information, I'll get the response that that needs to be put in an open records request. And with an open records request comes a whole nother set of challenges. I would agree with a lot of the research on the predictive factors of who's going to respond or contact a senator's office. I believe the casework part of it, the biggest factor would be the motivational factor, where someone has loss or a huge problem with an agency. They have kids who need health care. They have family members that are in corrections. There's a lot of motivational factor for the casework. We don't gather information on socioeconomic status per se. The only way we would know that is if their problem includes something that has a financial eligibility to it. So then we could guess at their financial status. I'd say on the policy side, the educational and socioeconomic stuff is a huge factor in predicting who's going to contact our office. This can be somewhat offset by really active, maybe a nonprofit that is very active in the policy side, but they also are really good at getting action alerts out to their membership. We see a lot of that. That's mostly again on the policy side, but then sometimes it turns into casework when we find that their questions and concerns about the policy side starts telling us their story, and we need to try and find them some assistance. One of the things Megan said was about 50% of the calls in their pilot program were more or less referrals or pass-through calls. I'd say that's probably fairly true of us here too. Another big factor that has affected how we do casework here is our ombudsman's office has really grown since I started 22 years ago. So they now have inspector generals on corrections and child welfare issues. So I really don't do any casework in those areas now because I send them up to the ombudsman's office. Again, though, the information flow even to the ombudsman's office was challenged in the last year. The Attorney General came out with an opinion which a senator had requested, and they challenged the ombudsman's office as a separation of powers issue, and the governor cut off all information flow to the ombudsman's office at that point. We're now working under a memorandum of understanding, but even with that, it's a limited time frame, and so in the next legislative session, the legislature will have to pass legislation to more or less reauthorize the powers of the ombudsman's office. And I overheard a staffer from the ombudsman's office telling another staffer recently that even under the current MOU with the governor's office, they feel like there are delays, there are made up reasons not to give them information. So there's challenges there. Megan said something that I kind of laughed at the beginning of her presentation about having volunteers do this, and the staffers shouldn't freak out because we're suddenly going to have to do these proactive calls. And I can guarantee you from our office that we don't have time to make those calls, especially during legislative session. And if we had to oversee students or volunteers of some sort doing this work, it would still be a task. From having interns, I know that sometimes, depending on the intern, that can take a lot of my time. So I think it's in theory a good idea, but in practicality for today's office, at least, I'm not sure how practical it is. I guess we can go to anybody's questions if you want.
Sure, and I will come back for the question portion here for both of you. And I want to start with Megan, could you tell us a little bit about your work studying casework? My experience is that casework in legislative institutions takes up just a huge amount of legislative resources, but it gets very little focus in academia and in the press. Am I reading that correctly? Is there a secret treasure trove of casework scholarship hiding out somewhere, or does this feel like uncharted territory to you?
There is not an extensive amount of work. There is some. And I would be happy to share resources with anybody that's interested. Email me and I'll send you a list of really cool stuff to read. But it's a short list. I'll be upfront about that. One of the challenges that I had was figuring out how to, because it hadn't been looked at and wanting to look at it as like a trend over time, right? Finding a way to figure out how to do that when this is a question that is very rarely, if ever, asked specifically about what was the contact afterwards. So a lot of this, and this is why the front end of the presentation was loaded so heavy with theory, is tangentially using the other participation literature that we know to bring it over and then test it out and see how it works. We're going to be taking some next steps to do individual level survey experiments, and just there's a lot more to do. I need to talk to a ton of people. Talking to Margaret was insanely eye-opening, and thinking about places that are transitioning more things over to an ombudsman's office. So I want to talk to as many people that want to talk to me. So if you want to talk to me, please come talk to me and tell me about how casework works for you so I can learn more, because the literature unfortunately is not there.
Right. And Tracy Peters asks, what factors did you consider when choosing the state representative you wanted to partner with to conduct your pilot?
This is all serendipity. When I was working in Senator Locke's office, I came to know Delegate Rasul, and we were talking, and it was a spitball thing that he said in passing about talking about how he's a Democrat, and he was talking about as the party of institutions, the party needed to do more to strengthen institutions if it wanted to go out and campaign on the strength of these institutions doing what they're supposed to be doing. And it was just an absolute, an amazing blessing to be able to work with Delegate Rasul. He is really dedicated to constituent-centered representation in general. So that was a no-brainer. And moving forward, obviously, I'd like to sample different types of districts. I like to do this in different offices. Particularly, I'd love to see this run in a Republican office and see how it goes. There's a lot of room here to find out more, and I'm just at the beginning, but so far things are really exciting and look promising.
Right. Now, we've got one hand raised. I have just one question. Before that, I will say, if anyone has any other questions, please feel free to put them in the Q&A box. Our next question here is related to the last one. From a practical perspective, what's it like doing academic work with real live elected officials and constituents? Do you find they're eager to help? Did you find there were any barriers? Did you have to work with, for example, an IRB to get permission for this kind of thing? What was that like?
There were significant barriers, and particularly because I had access to a person that that was into this thing, believed in it, thought through it, right? Like thought through the whole process. I had to work with someone in Virginia, and Virginia does not have a academic exception on access for voter ID files. So I did not have to do IRB because the only data I was allowed to look at was administrative, which was a bit challenging as well, right? Because when we have our voter files, we know more about the people and we can do a little bit more of that individual level analysis. As far as the office itself, Sam's office, and particularly Elena, I want to shout her out. She was amazing every step of the way. They were just really into it. And I think accessibility and availability comes down to like people that like believe in this. Like there's going to be people that like are like, yeah, this is it, let's do it. This is something that I think is important. And for those people, all of the ones that I've talked to thus far have been excited about either doing a trial, allowing me to look at data that they have. And outside of Virginia, when you can have access to a real voter file, from what I've understand with the beginning steps that I took going through IRB, it looks like this is going to be one that, again, because it's relying on majority administrative data, is going to be relatively easy to work with once you have it. But also on that note, data collection is going to be really important. Here, it was a concerted effort and a partnership. And so I was able to say, this is what I need, and this is what I want it to look like, and this is everything I need on each one, right? But we know that there's a really fragmented way of doing casework management. There's different CRMs, there's people running Google Docs, like there's a little bit of everything going on across the board with very little standardization. So I do think as we move to studying this across larger offices, standardizing and cleaning that data to be able to standardize is probably going to be a challenge.
I can piggyback on that with my experience in federal versus state.
Mm-hmm.
I know when I was in the federal Senate office that we had training, we had a great program to track it that set up reminders for us to continue to contact that constituent until the casework was closed out. At the state level, that's non-existent. There's no training, at least here in Nebraska. And from what I've talked to other staffers from other states, nowhere else that I've ever heard of. Is there any formal training or any formal way of tracking constituent work? So thank goodness I had that training in the federal office before I came to the state office, so that I had some idea of what I was doing. And another factor that has affected that is Nebraska fairly recently instituted term limits, and with the term limits comes a lack of knowledge both from the representative and the staff side, because when they bring in the new staffers who have not had that federal experience or had something similar, maybe in a campaign, they don't know what it's like, they don't know what to do. So I have mentored a couple of other staffers here and offered to do some training, but there's still no official training in Nebraska for constituent work.
Yeah. I think that does seem to be something that is kind of across the board. What I will say, both to you and anyone tuned in that is doing casework, there does appear to be an appetite at the federal level for figuring out some sort of system that would make ease of transition from state level cases going up to the federal case. I think probably the appetite grows more from their side of like funneling state related cases that need to come back down that are coming to their offices, right? So again, I feel like I'm just pitching this whole time. If anybody is having problems with this and is willing to be in conversation in the latter part of this summer, I will be in conversation with some people that are caseworkers at the federal level, and I am more than happy to bring your complaints, concerns, ideas, red flags to the table.
Great. Now we have a couple of raised hands here from our own panel, and I'd like to start with Marjorie Sauerbach-Thompson, who is our academic advisor for the Levin Center. Marjorie?
Hi, yes, I think just to provide context for this conversation, can each of you compare the size of your personal legislative staff? I know for Megan, it's the people you worked with, not yours personally, but what is the size of your staff? How many are full-time, or sometimes like in Nebraska, they might be session only? And give us sort of a sense of how much this is going to vary across states if we're going to argue that it needs to be disseminated more broadly.
I can respond to that a little bit. In Nebraska, each senator gets 2 personal staffers that are full-time. If they get elected to a committee, then they have a couple more committee staff. Most of the legislative staff in Nebraska are actually division staff, fiscal, research, revisers, that kind of thing. I was part of the Nebraska, or the National Conference of State Legislatures, does a lot of training for staff. And I was lucky enough to get to go to their Staff Management Institute long time ago. But one of the things we did was look at the staffing patterns of different state legislatures. And actually, with only 2 staffers, Nebraska was one of the more heavily staffed legislatures. There are a few legislatures, not very many, but a few that still only have session staff unless you're in leadership. But I thought it was interesting that Nebraska, being a fairly small populated state, had a fairly high number of staffers compared to a lot of the other legislatures. And I just thought that was fascinating, but luckily we are here. I know in Colorado, they still have kind of a mixture of that. They have some personal staff that's full-time, but mostly only the leadership has more than just 1 or 2. They don't have as many staffers on a personal basis as Nebraska does. Does that help?
I would say something very similar, 1 or 2, more if you're leadership, more if you have like more responsibility. That's why, particularly out of session, the volunteer network piece of it is really big. So it's really just activating the same people that would come in and help you campaign, or would knock doors for you, or would, come in and volunteer at any other thing that you have. And in some cases, Sam's mom sat and made calls for the weekend because we needed a 3-hour shift, right? Like there needed to be some calls made. I know the staff variation, as well as the variation in like professionalization of legislatures across states, is going to be tricky and challenging, which is why I try to center at least the call portion on volunteer networks, and then they're just funneling back anything that is and anything that requires action comes back to the staff that is, usually I know in Virginia we have like a district staff member that's there mostly to do like constituent service and stuff.
Right. And Jordan from New Hampshire has hopped in to say New Hampshire has 3 staffers for each legislator. They're named me, myself, and I. So, oh, right. And then I think we've got one more question here, one more hand raised from Robert Oldham. Would you like to hop in?
Yeah, sure. Thank you, Ian. Really interesting idea, Megan. Thank you for sharing it. I guess the thought I had was about both the framing and then maybe if you're doing it in the future, a different dependent variable you could use. So you kind of, your framing was about kind of how do we restore trust in democracy, and kind of a big framing, and then kind of situating it and how do we get people to trust legislatures, which I think is interesting. But maybe when we're thinking about what the outcome of this is, I wonder if you could do something more about the both like approval of the institution, like so approval of the legislature instead of the member, because I don't think that the problem with democracy is that members aren't popular enough. Like the fact that it raised their approval, like we know that they get reelected, so a conditional on them running, they tend to do pretty well. It's difficult to lose reelection. And this might be, you might run into some issues like differences between state and federal systems, but we know that members run it, they've long been more popular than the institution, at least at the congressional level. That probably varies a little bit more at the states, if I had to guess. But I'd be interested to see you add that as a dependent variable, like not just how does this affect what do you think about your member, but how does this affect what do you think about the legislature? Does this affect what you think about the state government, government in general? Is the process fair? Especially in this kind of age of populism that we're in, I think those would be really valuable questions to know.
Absolutely. And that's definitely one that I want to include on the survey. The survey is a little expensive, so it got away from me for my master's. So post-master's, I was like, okay, let me take some time and get my funding together. But on the individual level, you're absolutely right, Robert. That's another DV that I'm completely interested in. I want to know about trust approval, at the representative level and at the institution level, and particularly at the state level, because you're we don't see a lot of those questions on surveys.
Yeah, you could turn yourself into an anti-Feno. You're no longer talking about how members run against Congress by bashing Congress, but you can talk about how they do things to
well, no one has done Feno at the state level yet. I feel very inspired.
From what I understand, that their approval ratings are generally much higher of state legislatures and state government than Congress. But I think that's a really interesting thing for you to look at.
The few places I'm finding it, that's what I'm seeing. And I didn't get a chance to talk about it here, but even with Sam's district, so because we did it right before the 2023 election, it's observational. It's just a first glance, right? But I looked at his precincts, and out of all of his precincts, he ran uncontested for his delegate seat, and the Senate seat was contested. Out of all of his precincts, 7 of them, the Republican won the Senate race. But in those, there was only 5% ballot roll-off. So I can't definitively say that doing proactive casework outreach lowers affective polarization. But for years, they say the split ticket vote doesn't exist. But 95% of Republicans that voted for the Republican in the Senate race stuck around and voted for Sam. So we'll see. There's so much more to do. This is just the beginning of this project. I really do I will take any feedback, thoughts, opinions, ideas. I'm wide open at this point on this. And I really appreciate you guys taking the time to listen and think through it with me.
All right. Well, thank you very much. I have one more sort of self-serving question here, which is that my favorite genre of legislative story is the casework story, and I'm sure you both have them. Could you wrap us up on a happy note with a particularly happy, heartwarming casework story you might be able to share?
Margaret, you got one?
I'm trying to think of one categorized as heartwarming.
Or humorous. We'll take humorous.
The only thing that's coming to mind right now is there's mostly moms of children with what I guess you'd call it gender dysphoria. There's been a group of grassroots come together in the last year in Nebraska on that issue. And they come in and tell their story, and they're just so grateful that you will even listen and that you show any compassion. And as a staffer, I love the thank you notes. So yeah, I hang on to these and I decorate my office with them because it reminds me that once in a while I do something good. And yeah, one of the more heartwarming stories, I guess, was in a different office. I had a chance to work with a group of middle school students who wanted to work on climate change. And so we introduced some legislation on their behalf, and they came and testified. And it was really fun to see those kids get involved and to see their literal joy of being able to come and share their thoughts. And so those are the days that I hang on to.
Megan?
All right, so I'll share my favorite PCT pilot story with you guys. One weekend, a lady was called, I think it was like Friday or Saturday, I can't remember which day, but she's called over the weekend. She doesn't have any problems. She's an older lady. She was happy to just have a conversation, but she did mention she'd been having a hard time finding like a landscaping company to come cut her grass that was affordable. It was noted in the file. And in the following week, one of the members of the office staff called back because they were like, okay, we found somebody that'll do it. They have a senior discount. They'll come and do it. They called the lady, and the lady no longer needed her grass cut because the volunteer had gone to the lady's house and cut their grass for them, which I thought was the coolest thing.
That is delightful.
Right?
Oh, that's great. Well, thank you. My camera's blurring out here, which probably means we're about at the end point for our discussion here. Thank you both so much. It has been such a pleasure to have you, and I'm so excited. I'm so pleased we got to have this discussion today. We, at this point, are going to take a break of a little over 10 minutes. We'll be back at 5 minutes to the hour. That's 11:55 Eastern Time for our third paper today. Thank you all for joining us so far, and we'll see you back here in just a few minutes.
Welcome back again, everybody. And for our next paper, please join me in welcoming Professor Chinnu Parinandi from the University of Colorado Boulder and Assemblymember David Orentlicher from the Nevada Legislature. Professor Parinandi researches American political institutions with a focus on how regulation design influences policy outcomes and how institutional characteristics condition the spread or diffusing of policy. Assemblymember Orentlicher is a health law and constitutional law expert with experience in the Indiana House of Representatives. He serves in the Nevada Assembly and is the Health Law Program Director at the William T. Boyd Law School at UNLV. Professor Parinandi's paper is titled Legislative Capacity and Regulatory Compliance, Evidence from the Opioid Epidemic. Welcome to you both, and the floor is now yours.
I want to thank the Levin Center for putting on this wonderful event and bringing academics and policymakers together. I want to thank everyone for being here. I really want to thank Representative Orentlicher for taking the time to read the gibberish that I produced and offer really insightful comments. I'm going to share my presentation and try to go through it relatively quickly in the interest of time. 1 second. So the introduction's already been given, so I'm going to go past this. Important thing to note, this is co-authored work with Professor David Fortunato, who's in the Public Policy Department at the University of California, San Diego. So this is about the opioid epidemic. Obviously, this is an epidemic that is ongoing. It's received a lot of attention in the national media, rightfully so. And unfortunately, though, it's something that really hasn't been studied in political science, at least to the degree that it needs to. We've had thousands and thousands of papers written in academia about COVID-19, which really matters. But this opioid epidemic's been going on throughout that time. It's sort of gathering steam, especially sort of in terms of increasing the types of people and the demographics that it's affecting. And so we really wanted to write a paper about this. Also, sort of, I'm from the industrial Midwest. I'm from Ohio. I have friends that have been impacted by this. And so it's sort of personal for me as well in terms of using the tools of social science to look at how variation in the impact of this has occurred, right? So this has claimed 700,000 American lives since 1999. That's Denver's population is about 750,000. So, it's like the city of Denver was basically removed to give you some type of quantitative magnitude of this epidemic. It's the leading cause of death among American men aged 25 to 44, right? These are important decades in someone's life. These are decades in which someone puts down roots, someone establishes in a career, someone starts a family, right? So like, this is a really important event to study. It's been tremendously understudied in political science. So for example, we found 721 matches in Google Scholar for political science and opioid overdose, but 164,000 for political science and COVID-19. What's interesting about the opioid epidemic, and specifically about how and we focus, I should say, on the prescription pathway to the epidemic rather than fentanyl. Now we're living in much more of a fentanyl-based world, but from the 1990s and the first decade of the 2000s, it was the more classic pathway of addiction was through fraudulent use of or unlawful use of prescription. Now, what's interesting is while the federal government approves opioid pain relievers, right? The FDA is the approving body that allows someone to actually utilize these lawfully. It's the 50 states, and specifically the 50 state legislatures working in concert with medical and pharmaceutical boards that maintain their own distribution regime. So there's this vertical kind of piecemeal system for across the country in terms of approval, and then on the federal side, and then sort of like regulatory oversight amongst the states. And what our goal is to exploit variation in opioid overdose deaths across the states to evaluate or look at how institutional variation across state governments potentially impacts opioid overdose fatalities. And an implication here that we think matters is that governmental structural choices could influence death from the opioid epidemic. This is a chart of the 50 states over time. A lot of this won't be surprising to you, right? So West Virginia was sort of largely impacted by this opioid epidemic. You can see a state like Nebraska is at the bottom in terms of opioid overdose deaths. Florida is sort of the median state in terms of impact. What you see not just is variation in terms of how the epidemic has impacted a particular state, but also variation in terms of the swings in mortality by state year across the states. So our main argument is that legislative capacity matters, and legislative capacity is something that describes the amount of resources that legislators possess to do their jobs. There are various ways in which political scientists measure legislative capacity. Typically, it consists of staff size or expenditures, right? So some people look at the number of staff, some people look at staff expenditures. Another component that goes into this is legislator compensation and the length of legislative session, and this varies across the states. So on one hand, you have California, which is considered to be highly professional, for example. And on the other hand, you have New Hampshire, which prides itself on having a citizen legislature. And so there's variation across the states in terms of how much resources legislators have to do their jobs. Our argument is that state legislatures influence opioid overdoses through both policy design as well as regulatory oversight. So policy design would mean sort of if you have more time to do your job, if you have more resources given to your staff, if you have a longer session length where you can focus on these sorts of policy issues, you're going to have policy that potentially has fewer loopholes for the regulated, in this case, doctors that write prescriptions and pharmacists that fill them. You're also going to have less discretion for regulators potentially because you have more time to write a more thorough law. And so that may result in less gray area for the regulators themselves. Regulators here are state medical boards and state pharmaceutical boards. You might have more what's called policy innovation. You might figure out kind of more need for novel policy to tackle untested problems or unexperienced problems. And then you're also going to have greater regulatory scrutiny, right? And what this means is if legislatures have more time to spend on their job and more resources and more staff, the regulatory boards are going to give greater effort in their own jobs due to the possibility of greater legislative oversight. No one gets to, no one enjoys kind of like having to answer for their actions to a group that oversees them. And so you might be more prepared. You might go the extra mile, so to speak, in terms of making sure that doctors and pharmacists are doing their jobs responsibly. And so what we expect is that increased legislative capacity is going to reduce opioid overdoses through better policy design and greater potential scrutiny of regulators. Now, we use kind of a pretty broad analytical strategy. We look at the link between legislative capacity and opioid overdose deaths in 5 different ways. And I'm going to kind of breeze through this in the interest of time. One is a preliminary analysis linking legislative capacity to increased adoption of opioid mitigation policy that looks at the policy design part. Another is a preliminary analysis linking legislative capacity to the distribution of opioid pills. A third is our core analysis, where we look at legislative capacity and link it to actual opioid overdose death. A fourth is an analysis revealing the absence of a link of legislative capacity and other sorts of deaths of despair. And the fifth is a core case study comparing Ohio and Pennsylvania. And so I'm going to go through this preliminary analysis, the first one. So does legislative capacity influence the adoption of opioid mitigation policy? So what we do is we look at state level adoption of 4 kinds of mitigation policies. One is the adoption of a prescription drug monitoring system. The other is the adoption of a law requiring ID to get certain drugs from a pharmacist. The other is the adoption of Samaritan laws that protect people calling for help during overdoses, right? So if I'm unlawfully using opioids and a friend is unlawfully using opioids and the friend has an overdose and I call 911, I will not be prosecuted, right? That's what these laws mean. And then there's the adoption of liberalized access to naloxone, which is an anti-opioid that helps sort of deal with overdose. We look between 1999 and 2018, and we measure legislative capacity using staff expenditures per legislator, real legislator salary, and the inflation is adjusted to 2018 dollars, and session length, the amount of time a legislature is in session. Rather than looking, now we do this when we use 3 separate variables, but we in this paper scale them into an individual, like a single variable along the lines of Quinn 2004, and that allows for more flexibility. This is how legislative capacity looks across the states. Now, 0 is scaled to be like the median level of legislative capacity across the states. California's on the high end, New Hampshire's on the low end, Oregon and Iowa are kind of in your middle, your median legislative capacity. Now what you see here, and we have controls, but I don't show them in the analysis, is that legislative capacity has a positive relationship for most of the policy adoptions, right? So the way you'd interpret that is that states that have a higher amount of legislative capacity are more likely to adopt these kind of opioid mitigation policies. Now we go to our second analysis, which looks at legislative capacity and opioid distribution. So does capacity actually influence the distribution of opioid medications? Now, it's been really hard to gather this data because the companies are really good at, pharmaceutical companies are really good at placing limits on our ability to get this data. But we look at the number of OPR prescriptions filled per capita in each state for an 11-year span. The data have limitations. 92% of retail prescriptions are covered, so we don't have 8%. Buprenorphine, methadone dispensed through treatment programs, and opioid-based cold and cough medications are not included. So we don't have the total universe of kind of like potential pathway medications. We only have the number of prescriptions and not dosages. So this is not necessarily a direct measure of the amount of opioids that have been prescribed. And there's a lot we don't know about the aggregate causes of opioid prescribing due to proprietary data being withheld. So we have kind of simple models. This is a year by year plot of the relationship. And what you see is this negative relationship between legislative capacity and opioid distribution. So, it's a simple analysis, but one takeaway is that as legislative capacity increases, you do see less prescribing, right? So that suggests more of a relationship. And then we get to our core analysis of legislative capacity on opioid overdose deaths. We look at these deaths per 100,000 residents. The data come from the CDC Wonder database. And remember, there are two dimensions of how legislative capacity is going to impact opioid overdose death. One is the influence of capacity itself, and the next is this interactive influence of capacity on medical and pharmaceutical board agents. In addition to the legislative capacity variable, we also include counts of state medical and pharmaceutical board agents to get an idea of how many people actually work for these agencies. And we use two-way fixed effects, state and year OLS regression. We have a number of different controls, whether a state has a Democratic legislature, whether a state has a Democratic governor, the income of a state, the racial disparity of a state or diversity of a state, the unemployment rate in a given state. We also are able to include data on healthcare spending and dollars per capita in a given state. Economic mobility, which captures the likelihood that someone will move to the next kind of like income quantile or compared to where they are currently. We look at whether a state has allowed for medical marijuana, whether a state has allowed for recreational marijuana, whether a state has a law accounting for pain clinic monitoring, whether a state has a law accounting for prescription monitoring, whether a state requires ID to obtain prescription. We look at campaign giving to pharmacists, campaign giving to doctors, whether a state has adopted legislative term limits and whether a state has those term limits in effect. In a lot of states, they adopted term limits, but said like they're not going to take effect for 8 years or 4 years. So that's why we have those two variables. What you see here is this interesting relationship where you see that legislative capacity is negatively related to opioid overdose death. What you also see specifically with respect to pharmacy agents is this interactive relationship where increased legislative capacity actually augments the ability of pharmacy agents to do their jobs effectively. This is a plot that shows what a standard deviation increase in legislative capacity does to the work of pharmacy board agents as well as medical board agents. And what you see is this, especially with pharmacy board agents, this kind of this augmentation or this improvement of their effect. And that obviously that increases as you increase the number of pharmacy board agents. Now, one way of quantifying this is to say that if every state experienced an increase in legislative capacity of one standard deviation, and if agent numbers were held constant at observed levels, right? So like one way of quantifying this is to say that like if you don't change the number of agents that a state pharmacy board has, but you increase legislative capacity by 1 standard deviation, which means that like New Hampshire would move to Oregon, basically. In terms of the level of legislative resources that it has. Opioid overdose deaths would decrease by 2.66 per 100,000 residents. Now, based on 2018 data, this means a reduction of 8,750 deaths. That's a lot of people, right? So a shift of 1 means Utah having similar resources as Arizona. Now, that's easier said than done. In the conclusion, I'm going to talk about some work that I'm doing to help augment this situation. So like Utah in 2013-14 had a session length of 61.77 days, staff expenses of $259,900 per legislator, and a legislator salary of $21,915. Arizona at the same time had a session length of 179 days, staff expenses of $507,760 per legislator, and a salary of $44,571. So it would mean that Utah would more approximate Arizona on these attributes. Now, even smaller shifts produce benefits, not even accounting for increases in agent number. Now, one important question that we've gotten from reviewers and various folks at different talks is, how do we know that our pathway, which is hinging heavily on regulatory response to increased legislative oversight, how do we know that our pathway is actually germane? And what we do to establish germaneness of the pathway is we compare the influence of legislative capacity on other dimensions of deaths of despair, right? So for those of you, again, most people probably know about this, Case and Deaton, who are two influential economists, published a few years back this book called Deaths of Despair that looked at this astonishing rise in mortality. Their focus was on kind of like working class to middle class white men and women. But we've shown in social science now that like the deaths of despair is expanding beyond those groups to other groups as well. But the argument was basically that there was this astonishing rise in mortality among like prime age people. And they were trying to explain it. They were able to trace the astonishing rise to different pathways, including alcoholism, suicide, acquired illnesses, like type 2, not type 1, but type 2 diabetes, as well as drug overdose, right? And so what we do is we look at legislative capacity on these other deaths of despair, the non-opioid related ones, to see if our result is simply due to more governmental attention being on deaths of despair and not necessarily the unique regulatory pathway of opioids. And so if legislative capacity negatively influences alcohol, suicide, and diabetes mortality, then our argument about the regulatory relationship of state pharmacy boards would be more suspect. And this is a graph of mortality by year. So alcohol has increased, suicide has increased, diabetes basically is stable, but shows some increase. Opioids are much greater if you look at this comparison across all four. What you see here that's interesting is that legislative capacity does not relate statistically with these other three pathways, which suggests that our argument dealing with the way that regulators respond to legislative oversight has some potential credibility to it. Now, people would say, well, alcohol is regulated, and that's true. But at the same time, the regulation of alcohol is much looser in a way than opioids because of the broad social acceptance of using alcohol, right? Whereas opioids are much more kind of tightly regulated by states and presumably subject to more intense legislative oversight. So there's a null relationship for diabetes. We weren't able to disaggregate the number of the mortality based on type 1 versus type 2, but 95% of diabetes incidence is type 2. The results probably not due, at least in econometric terms, to quote unquote healthier states choosing higher legislative capacity. There's a null relationship for alcohol and a null relationship for suicide. Now, our final kind of empirical comparison looks at two states that have suffered quite dramatically from the opioid epidemic, Ohio and Pennsylvania. We compare these two states because they're really similar on a lot of important factors, right? So we're not comparing dissimilar places, right? So Ohio, based in 2010, had 11.5 million people. Pennsylvania had 12.7 million. So they both are highly populous states that are similar in terms of numbers of people. They both have similar racial demographics, right? They both are 81% white. They both are similar in terms of levels of high school education, 91%. They both are similar in terms of disability levels, right? 10% of the populations in each state are disabled under the age of 65. They both are similar in terms of ownership of housing. And they both are similar in terms of poverty rate. Now, what's interesting about these two states is that while they both are similar, Ohio did experience an increase in its opioid overdose death levels compared to Pennsylvania. Now, the data here go through 2018. If you look at more recent data, Ohio has experienced an upward trend again. And I should say that the COVID-19 epidemic was like throwing gasoline on fire in terms of opioid overdose problems, because people were in social isolation and sort of there's been a huge kind of explosion in terms of the opioid epidemic that happened in conjunction with COVID. Now, what happens when you look at the difference or the discrepancy in terms of why Ohio might have had a worse experience in terms of controlling opioid overdose death compared to Pennsylvania is that there's a difference in legislative capacity. Now, what's interesting here is that Ohio and Pennsylvania both have high levels compared to all states of legislative capacity, but Pennsylvania has a much greater level of legislative capacity. Now, what's interesting is that there are important differences here. Regulators in Ohio can set opioid prescription amount limits up to 90 days worth. So regulators have a lot of what we call discretion. Now, in Pennsylvania, opioid prescription amount limits are set by legislative statute at 7 days worth. So there's a lot more legislative control over how many opioids get prescribed in Pennsylvania. The only discretion that we saw in Pennsylvania law was for folks that are in hospice care or palliative care, right? There's not a limit for them. Now, in Ohio, regulators can determine whether providers should consult the drug monitoring system based on physician advice, and pain management clinics are exempted. Now, Pennsylvania requires providers to consult the drug monitoring system, and pain management clinics are not exempted. Additionally, in Ohio, there's no board reporting requirement. So the State Pharmacy Board of Ohio does not have to report like, in a kind of required way. I'm sure they do report, but not in a required way, to the Ohio House and Senate. Whereas in Pennsylvania, the Board of Medicine must file 2 reports about enforcement, specifically enforcement, each year to 2 different committees in the Pennsylvania House and Senate. So that means that there are 4 points at which the Board of Medicine and Pharmacy have to file and interact with the Pennsylvania House and Senate. Now, our argument is that this built-in institutional increased oversight in Pennsylvania is probably likely due to Pennsylvania's higher level of legislative resources where they can have those requirements. And that has downstream implications in terms of Pennsylvania regulators probably maybe just like being less accepting of taking doctors and pharmacists at face value about their own prescribing behavior. Right. And so the conclusion is that investment in legislative capacity produces less opioid overdose death. Regulators are responsive to legislative capacity and the amount of resources that legislators have. And combating issues like the opioid epidemic should also focus on political institutional factors that facilitate problem solving. I should add that my co-author and I recognize that asking publics to give more money to legislators to do their jobs is a politically really hard sell. And so a lot of the research now that I'm doing is drifting from kind of like what may be politically difficult to do toward ways to augment those legislators that are in states where they have less resources than they would like to do their jobs. And so I'm starting a project with a computer science professor and another political science professor who's at Ohio State. And we're going to look at how AI can be utilized to kind of help legislators detect and regulatory boards detect fraudulent activity by prescribers and fillers of prescriptions. So that's kind of where we are on this. Thanks for giving me the opportunity to present, and I look forward to all feedback.
Chinnu, thank you so much. Great presentation, fascinating paper. At this point, I'm going to transition over to Rep. Orentlicher for the practitioner review.
Thank you. I really appreciate being involved and the chance to read and respond to this paper. As Dr. Parinandi and Fortunato observed, legislative capacity plays a critical role in the ability of state legislators to ensure effective implementation of the laws we pass. So I'm going to illustrate with my own experience. As you heard, I served in the Indiana House of Representatives. That was 2002 to 2008, we are like the many states on the lower end of capacity. We were in session 2 to 4 months a year. The budget year, we had 4 months. The off year, we were 2 to 2.5 months. I shared an administrative assistant with 3 other legislators. So I guess that makes me 1/4 of the staff. That meant I had little help during the legislative sessions and in following up on bills that we passed, even though my shared administrative assistant worked year-round. In Nevada, where I serve now, staffing is even leaner. We're in session 4 months every 2 years, so we're one of the 4 states that meets every other year. I have my own administrative assistant, but only during the legislative sessions. So during the 20 months between sessions, I have no staff help when it comes to ensuring that the executive branch is properly implementing the bills that we enacted. And of course, I have to juggle my legislative follow-up with my full-time responsibilities as a law professor. And the capacity problem extends to many other activities, such as developing legislative proposals. So I'm doing that now. We're next going to be in session starting February of 2025. So I'm starting to think of bills for next session. And I formed a working group for one topic to see if we can do a better job in distinguishing in policing sex trafficking and not having unintended effects in other areas of sex work. And we had a meeting. We have a nice working group. We got together back in March, and we planned to reconvene a month or so later. Well, without staff helping me organize, it took us 3 months to find a day that we could reconvene. And it's just very inefficient when you don't have anybody helping you. Although I was glad to hear about Megan's presentation, so I'll talk a little bit about that. When I interact with staff for a member of Congress or for a legislator in a well-staffed state like California, it's easy to see how much legislative capacity can influence a state legislator's ability to influence implementation of a bill. So naturally, my colleagues and I would love to increase our legislative capacity. And as Dr. Parinandi said, that there are political obstacles, so we'll be very interested to see his AI work. But this study is quite helpful to us in making our case for greater capacity. If we can quantify the benefit of a legislative staffing increase in terms of saving lives, one of the most important things we can do, that should make it easier to generate support among our constituents. So I'm very glad that this symposium has brought Dr. Parinandi and Fortunato's research to our attention. I do have some thoughts on how we can translate these results into guidance for state legislators. Clearly, some aspects of legislative capacity are easier to change than others. For example, to turn the Nevada legislature into a full-time operation, as in California, would require a constitutional amendment. And there may be some important benefits from having part-time legislators. I do like the idea of being able to keep my job as a professor and serve. On the other hand, we could increase our staffing by statute. So going to full-time year-round may be unrealistic, but increasing staffing much more realistic. And as I say, we can do it by statute rather than constitutional amendment. So it would be very helpful to know how much of the benefit from greater legislative capacity turns on the different measures that Dr. Parinandi mentioned. There are a number of things in the summary index that he used in his research, but can we disaggregate that and how much turns on whether legislators are serving throughout the year rather than for the 2 to 4 months in Indiana or just 4 months every 2 years in Nevada, and how much of the benefit turns on the size of the legislator's staff. So, because as I said, I can more easily, work with my colleagues to increase our staff. And I can easily see how having a year-round legislature would help with the quality of legislation, since the time demands of a 4-month session can short-circuit the vetting of a bill by legislative committees. For example, it's not unusual for a bill to come over late in the session from the other house, and time constraints make for a brief hearing and a strong presumption against not amending a bill. Because if you amend a bill and we're in the last week of session, you're probably killing it because you don't have time to go back to the other house. And as Doctors Parinandi and Fortunato, they do estimate in their paper that 59% of the benefit of greater legislative capacity comes from better drafting of legislation. So if we can, so having a longer session clearly would be important, but again, that's going to be challenging to pass. But similarly, perhaps legislative staffing, maybe it is more important than the length of the session, especially when I think about members of Congress spend so much of their time attending public events, raising money for their campaigns or those of their colleagues, and also thinking of my own experience as a legislator and as the research we heard on constituent services reflects, I've seen how much I can do for my constituents by bringing up their concerns with executive branch officials and pushing those officials to exercise their authority to respond to constituent concerns. And this kind of service also applies to my reaching out to county or city officials in my district. So it would be very valuable to know how much of the benefit from increased legislative capacity comes from greater staffing as opposed to having a full-time legislature. Is there a part-time, well-staffed legislature or that we could look at, or do legislator time and staff correlate with each other, as some of the examples suggest? Relatedly, as the study points out, with the benefits of legislative capacity working through both legislative drafting and increased oversight, I'm guessing that staff to improve legislative drafting would be more expensive than staff for increased oversight, that the skill set for somebody who's working to help you do research on different policy proposals and what a good bill would look like is a more limited skill set than calling up and putting pressure on, nudging other officials. Anyways, that's something the further research would elucidate where we can, get the biggest bang for our efforts to increase our legislative capacity. And also, can we get a sense of when the returns to increased capacity start to diminish? The graph suggests that it's, the figures that you always continue to get benefits by increasing capacity, but usually there's some diminishing return. So is there some point where we can, an optimal point of increasing in legislative capacity? Some other questions come to mind, even as I say, we can do it by statute to increase staffing rather than constitutional amendment. It still may be difficult. My back of the envelope calculations suggest that it would cost at least $4.5 million a year to give each legislator in Nevada one full-time staff person. And that's $9 million over the biennium. And then there may be even resistance, even if the money's there. I'm not sure whether legislative leaders are more interested in consolidating funding in their own offices. We heard earlier from Margaret that you tend to see greater staffing, and that's my experience with people who hold leadership positions, and maybe they want to keep it that way. But there may be workarounds. For example, it made me reading this paper and thinking more about it. Maybe I could think about using my campaign funds to pay for a staff person year round. Or perhaps there would be internships to create opportunities to create internships for college, graduate, or professional school students in political science or other fields who might be interested in helping build legislative capacity. If research could quantify the benefit of a full-time staff person, that would be very helpful. Or again, the presentation on constituent outreach, proactive constituent outreach suggests that there may be good opportunities to build capacity through volunteers. Though my experience is that it can be difficult to rely on volunteers for state legislative work. People care much more about what Congress does than what their state legislature does. So it may be challenging to rely on help if they're not paid. The other question I'd be interested in learning more about is, are there lessons we can learn from historical transitions in legislative capacity? For example, how often does the state legislature significantly increase its capacity? Again, the clustering is at the low end, but there are, what led California and Pennsylvania and Massachusetts, New York, and other states, what leads a legislature to do so? Is it local cultural factors, political views, the state's wealth, political scandals? As the data indicates, states do cluster more at the low legislative capacity end of the spectrum rather than the high end, suggesting that moving a state toward the higher end is challenging, but perhaps there are things we can learn that can take advantage of. And I think those are the main questions that I had. The one other thing I wanted just to highlight that Dr. Parinandi didn't mention about his finding that high capacity legislators are less likely to, the lobbyists aren't as important, and that really ties into something I've seen, that as a part-time legislator, we have a big information gap, and lobbyists are quick to fill in. So if we can have staffing to address our information gap, that reduces the role of lobbyists, which I think is very important. And again, maybe a selling point for the public if we're trying to persuade them it's worth investing. If we can say, look, what the data show is lobbyists are going to have less influence if you increase staffing, that might be a persuasive selling point. So again, I really appreciate the opportunity to comment on this and to see this research, and I look forward to the discussion.
Thank you so much. And at this point, we'll swing over to some Q&A. I got a question here from Ben. How big of an issue do you think spillover is? If, for instance, Delaware made it really easy to get opioids, couldn't that impact overdose deaths in Pennsylvania, Maryland, Virginia, et cetera?
It's a great question. The way that we modeled this in the paper, it was one of the controls was we do what's called a spatial lag in econometrics. So we look at the number of opioid overdose deaths in neighboring states based on this assumption that looser laws mean greater opioid overdose deaths. And then we basically look at whether the neighboring states' deaths influence a particular state's opioid overdose death. It doesn't change the results. I think a more nuanced way to get at this, assuming that we have the ability to gather this information, would be to look at state attorneys general offices that coordinate with each other on these types of issues. A number of states also have multi-state task forces. This is separate from like the DEA, right, which deals with federal related issues, but like multi-state task forces. I'd be interested in trying to gather, and we haven't done this yet, gather information on the degree to which states cooperate with each other on the norming of drug laws and drug enforcement to get at this issue.
Thank you. And then I have a quick question, and anyone in the audience has a question, feel free to enter it into the Q&A. I'm giving a little bit of thought to, so Pennsylvania and Ohio are both full-time legislatures, and you have, that's the exception, not really the norm. You have a lot of part-time legislatures across the country, and I'm really giving a lot of thought to the use of the interim period, because you have lengths of sessions that are being used in this in the calculation to determine how professional legislature is. But that interim is a very important time for oversight in a lot of states across the country. And I was curious if there's a way to maybe try to expand, like looking and making sure that type of oversight, especially over this type of an issue, is being incorporated in your overall study. Any thoughts there?
Yeah, great question. We looked at whether there are study groups or standing groups or committees that exist throughout the year to oversee regulators. And we didn't find any change in the results. I think one way to get at this, and I didn't have time to talk about this, but we're organizing a survey of state pharmaceutical boards and state medical boards to get their side of the story, right? Because we're only looking at one side if we're focusing on legislatures, right? Also, like the regulators themselves would understand better, I would imagine, how like the interim works or what the differences might be between legislatures that meet the entire year versus those that meet part of the year versus those that will have a special session that's sort of organized to deal with an issue like this. So that'll give us more information to answer your question directly.
Great. No, thank you. Marjorie, your hand's up.
There, I got my clicking right to get the audio back on. We've been talking at several points this morning about how wonderful staff are, and I definitely agree that on the whole, lots of legislative staff are fabulous. But one of the things we discovered when we were doing our term limits research with the Michigan legislature, particularly with high turnover and term limits, we found a lot of staff who exhibited some revolving door kinds of issues. And the sort of blanket, let's get more staff, I think needs to come with a caveat that you want some restrictions on the extent to which those staff employees can then immediately go to the lobbying industry or firm, whether it's big pharma, big oil, big, whatever else. We found several examples of that, and staff who quit midterm on a legislator and went off to work for the organization that the staffer had been trying to convince the legislator to sponsor, support, advocate for legislation. And I think we want to have someplace in the backs of our minds when we're talking about staff that there's some who are absolute, the quintessential angels of government, but then there also are some problematic situations. At least in Michigan, the saints, in my opinion, of the staff folks were the nonpartisan staff. We have something called the Legislative Services Bureau, and those folks help draft the bills and do the research. And I used to have a very good friend there who was so nonpartisan that I asked him one time who he thought was going to win an election. And he said, I don't discuss politics ever. And I said, I'm not asking you who you support or who you vote for. No, I never discuss politics ever, and so some of those folks had sort of a lifelong mission of really being those kind of nonpartisan, not revolving door people that we want to idealize. And that might make it easier in some of the part-time legislatures to have a central cadre of people that everybody can go to, all of the legislators, and it's treated as confidential, it's treated as nonpartisan, it's handled very professionally, at least my knowledge of the one in Michigan. So that might be a way to help. That a suggestion to Dr. Parinandi. I believe, if I recall correctly, when California adopted term limits, their term limits bill also included a mandate to cut the legislative staff. So you might have a counter example of not the sort of infinitely increasing staff, but you would have a way to look at what happens to a highly professional legislature when you wipe out hundreds of staff. Literally, they just cut all of these staff positions. So you'd have an interrupted time series-ish sort of naturally occurring experiment. And then one last point, and then I'll be quiet and let everybody else have a turn. Some of the states that we're talking about with the part-time legislatures who have challenges with legislative capacity are also the states that have more opportunities for ballot initiatives. And there is one that we did a small amount of exploration of when we did the 50-state study that happened in the state of Washington. And it was called Initiative 900 of 2005. And they went to the people and they asked them if they wanted to expand the Auditor General kind of nonpartisan report writing staff. So another one of these central staffs. They did. The voters supported it. It passed. And it included a tax of an increase of a half a penny on the sales tax in order to fund those staff positions. So I think there might be ways that some of the smaller legislatures who would really have a hard time finding the money to pay for the large amounts of money that it would cost to increase the staff might be able to do something with ballot initiative sorts of things, because the voters, at least our experience in Michigan with things like the redistricting commission and so on, when you present a good government sort of initiative, the voters are actually eager for things that if you can convince them this is to protect your dollars, this is to make sure government works better, this is to get the politics out of it, they get on board in amazing ways, in bipartisan ways. So hopefully, we can kind of keep thinking about the staff thing, because there are certainly people who are wonderful staff, and we need more of those.
Well, and Margaret, just to build on that slightly, because it's not just building staff, but also just as our director, Jim Townsend, put in our chat here, the reallocation of staff resources, emphasizing these certain activities that just seem that they're correlating to the better outcomes. What made me so excited about this paper was I try to frame so much state oversight in what was the problem, what was the oversight that happened, what are the results? And this is so clear where our problem is the opioid crisis. We have the oversight. We have I think, a very good contrast with the reports that Pennsylvania requires versus Ohio not. I think that would be interesting to even take that as a 50-state study on these types of reports and what is required in other states that are not, and how does that correlate with the result of fewer overdoses and fewer bad outcomes. Fascinating paper. I really appreciate both of you, and thank you again, Chinnu, for submitting a really interesting, very powerful paper.
Thank you. And thank you for the wonderful comments as well as feedback and questions.
Yeah. All right. At this time, I need to transition it over to Ian for our next paper. Ian?
Yes, thank you very much, Ben, and welcome everyone to our fourth and final paper presentation of the day. There's still plenty of symposium fun to come afterward, though, with our roundtable and presentation of our inaugural Oversight Leader recognition. Our final paper today, Filibustering in the American States, comes from Jim Curry at the University of Utah and Rob Oldham at Princeton. Rob is a PhD candidate in politics at Princeton. He studies policymaking in Congress in the states. His published papers investigate the relationship between supermajority rules and bipartisan policymaking and how the media covers legislative achievements. His dissertation considers congressional policymaking in response to crises during the era of polarization. Jim Curry is a professor of political science at the University of Utah and the author of two books, Legislating in the Dark and The Limits of Party. His work has been published in numerous scholarly journals and national media outlets. He received his PhD from the University of Maryland in 2011 and previously worked on Capitol Hill for Representative Daniel Lipinski and the House Appropriations Committee. After the presentation, they'll be joined by the Levin Center's very own Jim Townsend. Jim is, among other things, a former congressional staffer, Michigan legislator, and graduate of our own Wayne State University Law School. He is the Levin Center's executive director. Welcome all. Jim and Rob, please take it away.
Thank you, everyone, for thanks to the Levin Center for accepting this paper. It's not entirely about oversight, but it is about state legislative politics and kind of the processes, the internal processes of legislatures. So hopefully, it's at least somewhat on theme for for what the center does. So we're curious about how supermajority rules work in the states. Kind of filibusters are what we tend to think about in the United States Senate, where we have a supermajority debate rule. But there's kind of increasing recognition that this is possible in the states too. That if you have a debate rule that's similar to the Senate filibuster, in the Senate you have a 60-vote cloture rule saying that you have to have 60 senators in order to cut off on debate on the bill. But if you have rules that look similar to that in the states, how exactly does this work? And can we make those types of comparisons similar to what we see in Congress? So I'm going to start off with an example that you may be familiar with, which is a debate about abortion in South Carolina in 2023. So the South Carolina House had passed a total abortion ban in February. And when it went to the Senate, there was a majority of members, so a majority of Republicans in the Senate that were supportive of this ban. But there is a rule 15A, which requires, in order to shut down debate, you need to have 60 senators present in order to do that. And so even though that there was a majority of the chamber in favor of this House ban, you did not have 60% of the senators on board with it. There was actually 4 failed cloture votes that were over 50%, but less than the 60 required percent. So we never actually saw this bill receive an underlining a final passage vote because of this cloture rule. So the end result of this is that the Senate ended up passing a moderate bill. So the initial opposition came from a few Republicans who were uncomfortable with passing a full ban on abortion, but they were okay with passing a 6-week abortion ban. So the Senate ends up passing this ban, and this ends up becoming law. And so what we see here is it's basically a pretty classic example of pivotal politics. So pivotal politics, if you're unaware, is this famous model of legislative policymaking, where the person who is the pivot in the chamber, this is someone who has institutional power because of some rule. In the case of the U.S. Senate, it's the person that's the 60th senator who's, we call this person the filibuster pivot. This person can essentially veto any legislation that they don't want. They can block it, or they can force the majority. If the majority is in support of a bill, they can force the majority to moderate their bill. The P right here, that's the pivot member, so that would be the filibuster pivot, so the 60th senator. And you can see that there's a distance between the pivot and the M, which is a stand-in for the majority of the Senate, so the person who's the 50th vote in the Senate. And so that distance, can only be made up if there's a compromise by the majority to, switch the policy to something that the pivot prefers, which is what we saw in South Carolina. So this is how we tend to think that filibuster rules should work. And this is, kind of how we think about the relationship between filibustering and, rules in the legislatures generally. It's a lot of that understanding is coming from the Senate and from this famous model by Crable. However, we can also see examples where it doesn't really work like this. So another case of abortion, this is Missouri in 2019, where a heartbeat abortion ban was under consideration. And in this case, there is no cloture rule. There's no supermajority pivot. The House and the Senate both allow a majority of members to end debate. But despite this, Senate Democrats were still able to threaten a filibuster. So, using sources of leverage that had nothing to do with this debate rule, they said that if, you didn't do something to moderate this bill, then we're going to, impose cost on you, that it's, going to make it difficult to, pass other parts of your agenda. And so the result of this was that they ended up, the bill was moderated, much like in the South Carolina case. There was a 2-parent notification requirement that ended up becoming a 1-parent notification requirement. And then the Democrats still all voted against the final bill, but they had at least obtained some concessions and changing it. So this isn't really in line with the Crable model. The Democrats didn't have a veto from a pivotal position like the filibuster. They were able to use other parts of the rules in order to do that. So this leads into the question for our research, which is, when are these supermajority debate rules? When are they necessary or sufficient in order to allow legislative minorities to obtain influence in policy outcomes? So the Congress literature and the media, they tend to identify the filibuster as and the supermajority pivot as being pretty key for legislative minorities in order to have influence. Often claiming that if this didn't exist, then we wouldn't really see any bipartisanship or any legislative minority influence, at least during times of unified government. However, the Senate filibuster has not really always worked like a supermajority rule. In the past, its majorities have actually tended to prevail in the Senate. That's due to both changing norms over time and also changes in things like the time pressures that senators have faced. So this is as we think about how these the Senate filibuster translates into the states, these are also relevant considerations. So the reason we wanted to study this phenomenon in the states is because there is a lot of variation in what kind of rules states have. Some have majority rules, some have supermajority rules. Among those supermajority rules, the threshold changes, which I'll show you a little bit more about in a minute. State legislative filibustering also has received a lot more attention in recent years, particularly since Wendy Davis led a filibuster in Texas Senate in 2013, again, over the issue of abortion. But so far, scholars haven't really paid a lot of attention to this. To the extent that we do see supermajority rules being incorporated in models, it seems that scholars are assuming that they do work like the pivots from the Senate model. And so this is something that we're interested in exploring and whether this assumption is justified or not. So Jim and I basically conducted a systematic data collection where we tried to find what every state's debate rule was in order to ask the question of whether chambers with supermajority debate rules see outcomes that suggest that legislative minorities have more power in those chambers than in other chambers. And specifically, the things that we looked for was more media coverage of obstruction. So do we see more examples of obstruction in these states? Do we see larger roll call coalitions, suggesting more compromise in these states, as well as fewer close votes? So do we see fewer instances of majorities kind of ramming through their policies? And we also were curious about whether major legislative proposals were more likely to fail in these because the filibusters were being used to block them. So our new data, first we looked at all 99 state legislative chambers, looking at the years 2017 through 2024 to find out what each state's chamber's rule was. When we looked through those rules, we looked to see whether for words like how do you call the previous question, which is a way to cut off debate? What's the threshold for cloture, which is the word they use in the Senate? Or is there anything that they can use to end debate? So we looked for words like that in all 99 of these rule books, most of which I found online. I only had to get one state legislative chamber to email me the rules, which was interesting. So overall, what we found is that of the 99 chambers, 72 of them only required a simple majority to end debate, and 27 had supermajority rules. So of the 27 that had supermajority rules, 14 were state houses and 13 were state senates. Maybe surprising if we tend to think of senates as the smaller bodies that prioritize debate and consensus more than state houses. And when we thought about these rules, we basically considered anything that looked like it could plausibly give the supermajority pivot the ability to obstruct the majority. So this was usually straightforward, but there were some times where the thresholds between cloture and ending debate seemed to differ. Sometimes there would be time limits on debate that could be imposed, talking filibusters, so to require a member to hold the chamber for the entire time, and then some rules that only applied in the committee of the whole. So we had a few instances like this that we still consider supermajority rules, but again, for the most part, they were pretty straightforward. So just because this is people that are interested in state politics, I think I could show you a few of the states that actually use rules like this. Especially if you're from one of these states, you might find that interesting if you didn't know that. So here's the 5 states, or the 5 chambers, I'm sorry, that use the 3/5 rule. Here are the 18 chambers that use a 2/3 rule. I'll leave that up for a second so you can look at it. You'll notice that sometimes, again, the state houses and the state senate will have the same role, but in a lot of cases, a state house has one role and the state senate has a different role. Often one chamber has a majority role, the other has a supermajority role. So that's actually some variation that we're going to be leveraging later in the paper. And finally, here are our states that have pretty restrictive rules. So the require 3/4 debate in the New Jersey House and the Vermont House. And then the Utah Senate and the Vermont Senate have rules that say that there's no way to call cloture or to call the previous question. You have to have, it seems to imply that there needs to be consensus. So this would be a pretty restrictive debate rule. So in terms of the outcomes that we're interested in, so how can we see the influence of these rules? We looked for examples of obstruction. We obtained these by searching the database Newsbank to see for 2013 to 2023 to see, simply is there coverage of obstruction or filibustering happening in these states? We looked at open states roll call data for 2017 through 2022. Again, this is to see what the size of the roll call coalitions were and whether there were a few narrow wins, as we'd probably expect to see in these supermajority states. And then we also collected an original data set of gubernatorial state of the state proposals from 2019. We can consider these fairly high profile legislative proposals. And for these, we wanted to see, was it more likely that these would fail, or at least that they would be more, consensual, or, we can think of these as more moderate proposals in the states that didn't have supermajority rules. Or sorry, had supermajority rules. So first, I'll show you just a little bit about the media obstruction study. So we were, again, we're curious about with states with supermajority rules, do they have more media coverage of legislative obstruction? We'd be the first to admit that this is somewhat problematic of a test. Obstruction is a difficult thing to observe. The media might not actually be covering it. And moreover, media covering state politics is not like the media covering national politics. There's, it's often, media outlets are pretty sparse there. They're sending fewer and fewer reporters to state houses. And so this, this might not be the most likely place to find evidence of obstruction, but it's worth looking at anyway, especially combined with other tests. So we have just a pretty simple regression model where we looked at whether a state featured no obstruction, no examples of obstruction, some examples of obstruction, or significant examples of obstruction, which we counted as having 5 or more. And then we also included controls for whether it's a part-time or a full-time legislature and the number of news sources that the state had. And so the regression result to look at here is basically the top row for supermajority rules, where in 2 different models we looked at whether there was a correlation between the presence of this rule and more examples of obstruction. And basically both models failed to upturn any evidence of this. So we found null results for this first study. But again, it was imperfect, so we also wanted to look at evidence of from other sources. So next went to roll call votes. Again, asking whether the states had larger roll call coalitions and fewer narrow wins in states with supermajority rules. So from the website Open States, we were able to download about 149,000 bill passage roll call votes. So these are only votes that are happening on the final passage of bills, not things like amendments or other motions that might be offered. Of those, about 55,000 were contested. So that meant at least one member voted nay. These might, we might think there's a difference between ones where there's contestation versus where there's not. And our 2 outcome variables were 1, so coalition size, which we measured as the percentage of the votes that were yes on a vote. And then second, whether just a binary coding for the vote about whether 60% or fewer members supported it. So we first did some cross-state comparisons. So we wanted to see, if states that have supermajority debate rules or chambers that have them, how these differed from ones that did not have them. And so we needed a point of comparison for this. So we looked at data that I had gathered on tax supermajority rules for a previous paper. And so tax supermajority rules, there's no question that these function as pivots. These are generally written into state constitutions, and they lay out a threshold that says this is a supermajority rule. So it's a little bit different than a debate rule, which can change in line with rules or norms and time pressures, as we've seen with the filibuster. And so in the graphs I'm about to show you, each regression coefficient basically shows the difference between chambers with supermajority rules and those that clearly have majority rules. So this table here shows the the filibuster rule, so states with filibusters versus one without filibuster rules. So these are the two coefficients on the far left. And we see that regardless of whether we're looking at all votes or contested votes, it doesn't seem like there's any marginal effect of having a filibuster rule in terms of the size of your state roll call coalitions. But instead, if we look at the tax supermajority rules, which again, these are rules that we know function like, we know they create pivots, we see pretty substantial effects, both overall and when we're only looking at contested votes. Beta look pretty similar if we're instead go to the variable we're looking at 60, what's the likelihood of having a vote that's less than 60%. We don't really see any effect in the states with filibusters versus those with, or states with filibuster rules versus those with non-filibuster rules, but we see a pretty substantial effect in the tax supermajority rules. So next we wanted to do some in-state comparisons. So these are the states, there's 9 states where one state has a supermajority rule and the other does not. And we wanted to basically see, or do roll call coalitions, do they look different in the chamber that has the supermajority rule? And for these, we make a comparison with Congress because Congress, also has the House versus the supermajority Senate. So we thought this would be a useful way to, kind of benchmark what we should expect to find. And we basically see pretty similar results as last time. We can't find any effect in the states when we're comparing within these chambers in the states, but we see pretty massive effects in Congress when we're comparing House roll call votes to Senate roll call votes. Senate roll call votes tend to be more have larger coalitions, and they tend to be much less likely to be less than 60%. Again, we don't really see those effects in the states. It seems like all the votes, the rules don't seem to, be associated, at least obviously associated with any differences. Okay, finally, we'll talk a little bit about the gubernatorial proposals we looked at. So, we're interested to see whether we see more failures of key gubernatorial proposals, and also whether there's the ones that do pass, or those more consensual to the, so does it seem like the governor's proposing, perhaps less controversial bills in supermajority states. And so Jim and I read through every state of state address for 2019. We identified 336 policy proposals, so nothing that would go into the state budget. This is a distinction that Cowser and Phillips made. And so we identified about 6.7 proposals per governor, about which 2/3 were successful. So in this first regression, we're looking at whether those proposals tend to be more successful in supermajority states. And so this top row shows us that when you have a supermajority rule, it doesn't seem to have really any effect on the probability of success for a gubernatorial proposal. And when we just look at the states that have just the gubernatorial proposals that were successful, do we see that they tend to be less controversial, or are they less likely to have a narrow win? And again, we don't see any results. So the supermajority threshold doesn't seem to make any difference. So just to summarize our findings, we don't find, it's a lot of null findings, a lot of lack of evidence. We don't see any more examples of obstruction in states with supermajority rules. We don't see larger roll call coalitions or fewer narrow votes in these states. And we don't find that governors seem to be just as successful, and their proposals seem to be just as controversial or not controversial as states, and regardless of whether you have a supermajority rule. So this leads us to conclude that state filibuster rules or state debate rules, they're not really operating like the Senate filibuster. This doesn't mean that they can never operate like that. We do see this in cases like Nebraska and South Carolina, but it doesn't mean that it doesn't seem like we're consistently doing that. So, kind of our advice is we shouldn't automatically treat them as pivots and models, particularly when we're looking across 50 states. Instead, we should try to, resist the temptation just to read the rules and try to make assumption about how a legislature operates. And we should be more attentive to the ways that chambers might empower minorities outside of the rules. So things like norms and practices that are not easily captured by these rules. So yeah, I think that covers me. So turn it over to Jim for the comments.
Thank you very much. And now the Levin Center's very own Executive Director, Jim Townsend.
Well, first of all, can you hear me okay?
Yes.
Okay, good. First of all, I just want to thank our authors for really presenting an excellent paper. It was really well organized and argued. The research methodology, as far as I could tell, seemed really solid. And this is an ideal paper for this kind of forum, because it seemed to me in reading the paper that you have pushed pretty far the quantitative tools that you had at your disposal to try to get an answer, to try to understand the effect of these rules and whether they acted as pivots. And now, you're sort of finding that you've got to go beyond sort of the quantitative and get to the qualitative side of things and start talking to lawmakers, practitioners, people that are involved with the process to try to delve more deeply. Maybe there is some additional quantitative work that can come out of that, but at this point, hopefully our conversation can be part of where you're going in terms of talking to people who are in the process. So what I'll start with is just saying a word about my own background, so you know where I'm coming from. I spent relatively early in my career, I worked in Congress as a staff member, both in the Senate and the House. And so I did observe, now it was quite a while ago, but I did observe the way the U.S. Senate operated and the way the filibuster was treated and the way members reacted to it. And then later in my career, I was an elected member of the Michigan House of Representatives, which is one of the states, as your study points out, that has a majoritarian policy when it comes to bringing debate to a close. So I can kind of give you my feedback both from these experiences and then from the work that we've been doing at the Levin Center in terms of understanding what's going on across a lot of states as well as in Congress from an oversight perspective, but still we're dealing a lot with lawmakers. So I'll just have I'm going to go in a couple of different directions in my comments and try to be responsive to some things that the authors wanted me to kind of focus on. The paper mentions a series of factors beyond the rules that probably or could explain why the filibuster or these super majoritarian rules don't seem to have much an effect on legislative behavior in the states. And they include things like professionalism, the length of session, partisan dynamics, and political norms and culture. And throughout the study, you point to where you've used those, included those factors as variables in order to control for them and isolate, the effect of the majoritarian or supermajoritarian rules. But I'm wondering and maybe this is in the statistics and I didn't really pull it out, but did you have were you able to identify an interaction between those kinds of variables and the ultimate outcomes you're looking at? In other words, how did say professionalism or length of session or these other dynamics interplay with the use of the supermajoritarian rule? I think that's something we could talk about and because I think that's one of the areas I think you're going to go in terms of extending your research. I want to point out a few things that you might want to consider as you're looking beyond what you found so far, this sort of lack of effect. And I want to start with norms. It's clear that there is something about the way lawmakers view limits on debate or using a filibuster-like tool as a potentially a violation of a norm or being not considered sort of proper in that context. And I want to suggest that maybe what's going on here, at least in some states, is that lawmakers are always going to be, even if they're in a very considerable majority, their thinking is going to be influenced by by their desire to preserve their ability to form legislative coalitions in the future. And that imposing or silencing debate could be damaging to relationships that they might need in the future to form coalitions on issues where their own caucus is divided, but the leadership wants to move forward on a piece of legislation or wants to move an agenda forward that isn't something that is easy to push through with their own majority. So I think that's one consideration. Another difference, I think, between Congress and state legislatures, and for this, I can't cite any data, but it's my impression generally, and that is that it seems to me in my experience in Michigan, and to some degree looking at state legislatures, although this is not something we examine too carefully at the Levin Center, is that power is more concentrated in the leadership, where there's a greater concentration of power in the hands of leaders at the state level in legislatures than you see in Congress. Now, this is a changing dynamic, obviously, and a lot of people have commented on how power has gotten more and more concentrated in Congress. But certainly my experience as a lawmaker in Michigan, I found that there was considerable concentration of power in the speaker and in the majority leader in the Senate, Speaker of the House, majority leader of the Senate. And I wonder if that doesn't cause some members to be disinclined to filibuster or do things that are perceived as obstruction in a majoritarian state like Michigan, where you'd be concerned about consequences of doing that in terms of what the leader, say the speaker or the majority leader, might be able to do to you if you engage in obstructive tactics. So that's another thing I think you might want to consider taking a look at. Another thing I think that really came through, of course, again along the lines of what makes the Senate, the U.S. Senate, different from these states, might be the way the public views obstruction, or at least using a tool like a filibuster to obstruct. It would be interesting to try to do research to probe how the public views obstructive tactics at the state level, on the theory that government that is closer to the people and the services that people rely upon might trigger them to be a little less tolerant of obstructive tactics. So that's another thought that occurs to me, is that state lawmakers may be less inclined to use these tactics because they're not sure how well they'll be received by constituents. And then another idea that you didn't really touch on too much at all, I think, in the paper, and that's term limits. And term limits term limits are one variable that distinguishes Congress from some state legislatures. Obviously, there are quite a few state legislatures that have various types of term limits, including Michigan, where I served. And I think it might be the case that the existence of term limits can have an effect on people's knowledge of and adherence to the norms that we've been discussing. Now, whether that is consistent with the story that the data seems to present, which is that these norms seem to be powerful and discourage the use of these tools or the clamping down on people when those tools don't exist. It's still something I think if you want to get into and understand norms, I think you might do well to take a look and distinguish the data in states that have term limits and lots of relatively inexperienced legislators because of that, versus states that have no or very long term limits, where you've got a lot of lawmakers who've been in the culture for a long time, and maybe those norms are very, very salient to them. I was asked to sort of take a look at a number of issues, and I've already touched on a few of them, starting with norms. I think to understand norms as they might apply in state legislatures and in Congress, but in this case, for our purposes, in state legislatures, I can speak to my experience with serving in a state legislature as an elected member, I would say that that politics in a state legislature, and even more so than you'd see it, say, in retail politics, engaging the public, are really about personal relationships, or about trust and rapport, mutual respect. All these things matter a great deal, and some of that is, I think, I think people observing the way legislatures behave and the rhetoric that is being used these days, you might think that these personal relationships don't matter very much because of the way, the really fiery exchanges that occur. But I don't know that that's the case. Certainly in my experience, both on Capitol Hill and then as a serving member in Lansing, Michigan, personal relationships mattered a tremendous amount. And so I think that speaks to some of the norms that might be really at play in trying to understand why states don't follow sort of the model, the pivot model that the rules might suggest. I think elected officials, one of the things that binds them together is the fact that they've gotten elected. So it isn't just the fact that they're serving in this particular body. It's just more generally the fact that they have stood for election and been successful and gotten elected. And that is something that binds lawmakers together to some degree. It's sort of like being part of a club. And so I think the norms that attach to that are kind of part of why this is sort of important. So in saying all this, I think what I'm trying to get across is that because of this kind of culture, it's quite possible that lawmakers would be sort of hesitant to use every lever at their disposal to bury their opponents and prevent them from being heard, or perhaps to obstruct on the other side to obstruct the progress of legislation, because they'd be concerned about destroying some of these personal relationships. Another thing that I was asked to kind of take into consideration was my experience serving in Michigan, where I served as a Democrat and was in the minority during the entirety of my career. And the question was whether obstruction was used by the minority and under what circumstances. And in my experience, and again, Michigan being a state that has majority rules that apply to the end of debate, obstructive tactics were not used in very often or very effectively because of the way the rules are set up in Michigan. It was not very easy at all for the minority to obstruct the process, to try to filibuster or do anything even close to a filibuster. And really, in my experience, really going back to that concentration of power in the speaker's office, lawmakers were relatively disinclined to even attempt those kinds of tactics, partly out of concern about the power the speaker wielded, but primarily just because the rules didn't seem to allow it. But in the few cases where members of the minority did try to mount some sort of obstructive effort to try to slow down consideration of legislation, for example, it was usually, in a situation where the issue at hand was of primary importance to core caucus constituencies, and there just were no other options available to try to make some sort of expression of the minority's view on that issue. The other thing I was asked about was just sort of the issues of bipartisanship and and when that happened and when that could be done. And again, bipartisanship on really important, highly contested issues was relatively rare in my experience as serving in the Michigan legislature. But there were a few exceptions to that. But in general, there were lots of votes that received strong bipartisan support, but they didn't tend to be issues that were that were hotly contested or issues about which there was a lot of controversy. The majority, for the most part, was able to hold its caucus together and vote in a very strong block, and that generally prevented, gave them the opportunity to carry the day on legislation that they were trying to push forward. Not in every case, but in a lot of cases. And when it came down to legislation that they could not achieve that outcome, a lot of times that legislation just did not move forward. So I hope my comments have been helpful in terms of giving you some ideas about where to take your studies and the questions you might want to be probing as you move forward and try to get at this riddle that seems to be kind of difficult to unpack. And I'm happy to join in the Q&A session.
Thank you very much. And I will say, for those of you who have questions, you are more than welcome to submit them through the Zoom Q&A function. I don't see any just yet, so please fill them in. But it does mean it's good news for me because I have a few written out here. To get us started, Rob, you mentioned in your bio you've done some work with Congress. And a lot of what we do is promote work in the states, which is in many ways pretty different. And I'd be interested in learning about some of your impressions of gathering data and conducting analysis at the state level. Reading the rules for 99 legislative chambers and collecting all those other data sets, I think, is an excellent show of your own ability to suffer. For viewers who are perhaps considering an academic venture into the state world, do you have any tips or hard-earned wisdom to share?
Yeah, gathering data for the states is a real pain, I think, compared to Congress, not only because there's 50 of them, and sometimes the chambers will even have different websites. Particularly if you're trying to do roll call data at the individual level, it's very difficult, as Jim and I have discussed for this paper. One of the limits of our roll call data for this for this project right now is we can only really look at the overall size of the coalition. We can't say too much about the partisanship of the coalition. So is it like a majority leaning coalition? I actually do have that data for the tax roll call votes that I talked about a little bit about too, and that that took like 2 years of my life to gather all the tax roll call votes. You had to code them state by state. The states are never similar to each other, or it's really, really hard. So that's why it's good to have resources like Open States that just give you like, this is how many yays there were and this is how many nays there were, but we don't really have the resources like we do in Congress to easily aggregate that by party and by different different numbers. So if anyone has knows of anything that I'm missing, let me know. But that's been my experience so far, is that it's really difficult.
Yeah. And I will briefly plug, as our brief advertising moment here, the Levin Center's State Oversight Academy Legislative Oversight Wiki, which has all kinds of fun information state by state. We don't get down into the tax roll call votes, but we do have state by state information on oversight mechanisms and all kinds of other information. So if you have... to anyone, if you have data you'd like to contribute or there's data you need, please take a look. Let us know how we can help. And we'd love to see it. Ben Goehring has hopped in here with a question. The first is the colleague Mitchell Bosley has done some work on measuring obstruction via legislative text, and it could be helpful. I think, Rob, the link is there for you in the Q&A. And another question from that same one, are chambers setting their own rules? I get why Mitch McConnell and Schumer are hesitant to remove supermajority rules because they know they'll be in the minority at some point, but that's not the case for Dems in Hawaii or Republicans in Idaho. Why do they keep the rules around if they can change them?
Yes, so they do change them. That's actually a difference between these rules and the other supermajority rules I mentioned. The tax rules, those are constitutional and generally you need like a ballot measure or some kind of something like that in order to implement them. So these rules are all endogenous. Yeah, it's a good question why they remain, especially in states where they're utilized. I know we'll have the speaker of the Nebraska Uni later, John Arch. I'd actually be curious to hear what he'd say about that, because they did have a good amount of filibustering in the 2023 session, and he was asked why don't you change the rules to make it to make this easier for you and the majority just to get on, and he just said, because that's not really what we do here. We want to allow the minority to say their piece, and so I mean so you can think of it as maybe in that instance at least working like a some kind of conflict resolution mechanism where members would rather do things that are easier. They don't necessarily just want to steamroll their opponents every time, because that's gonna heighten the the conflict that you might see on other issues. So that's that's one possible theory. I think in other cases, like the Hawaii Democrats, they might not change the rules just because they don't really care, or like if the norm is that we don't use this anyway, then this is just something that kind of gets put into the rules every year, and no one really notices it. I know that there's, if anyone here is familiar with New Jersey politics, which has I was surprised to see that there's a 3/4 or 75% debate rule in the House. And so I asked a friend who's he worked in the legislature there, and he's on the staff. I said, "Do you know about these rules?" He's like, "What are you talking about? I've never heard of that rule." And I'm like, "Well, here it is." He's like, "Okay, no one cares about that rule." so I think that it varies by state to state, and why they don't get rid of them. But I think we could think of a variety of reasons across them, which is part of the reason why the next step that Jim and I want to take on this paper is to talk to people in these states and try to incorporate at least some of their perspectives into the paper.
Hey.
Yeah, I would just I think that's all that Robert's points make a lot of sense. I would just add that I think lawmakers are majorities are keen not to be perceived as overreaching. So it's about the relationships with people on the other side of the aisle, considering that there may be a need for to work with some of those folks on things that your caucus is not unified about. But then there's also just sort of a broader notion that people that when you have a lot of power, when you are in the majority and you're pretty secure in your majority, one way to screw that up is to overreach. And so they may be somewhat reticent about doing that, because they just they don't want to fall into that trap. It's hard to say, but I think something around these norms and around these relationships is probably at the core of the answer.
Yeah, and your thoughts on that were extremely helpful, Jim. I think thinking about particularly how this might differ in states with term limits, and thinking about the role of leadership power, those are luckily tools that we can get. We have empirical measures of term limits, but then also leadership power, and that could be really fruitful and interesting. I was looking through the list of states, and it seems like at least there's at least a few of them that have both term limits and supermajority state rules or supermajority rules. So differentiating within that group based off term limits could be really interesting. So thank you.
Good. I'm glad.
I think we have time for maybe one or two more questions here. We've got one in the Q&A from David Orentlicher. He says, "I'm interested in your mention of states with supermajority rules for tax increases, something we have in Nevada. Comparing the level of partisanship in Indiana that didn't have a supermajority voting rule with Nevada, the Nevada legislature seems more bipartisan in general. Minority bills are much more likely to be heard and passed. I've thought that the majority's need for minority support on tax bills leads the majority to work with the minority on non-tax bills. In your 2024 paper, did you look at that kind of connection, or did your measurement of voting patterns focus at all on tax bills?"
Great question. Thank you so much, Representative Orentlicher, for asking that. That's a good point. So the paper itself focuses on the bipartisanship on tax bills generally, and basically what I find is these rules do have an effect of on the bipartisanship of tax bills. If you have a supermajority rule in place, then you do see a pretty substantial increase in bipartisanship on those bills. But kind of within that, I also find that even if we're only looking at the states where majorities could ram through bills because it's like a democratic unified government who doesn't have a supermajority rule, we're only really seeing them ram through bills, maybe like about a third of the time. So it's not as common as you would think, which that's kind of the big takeaway from the paper is majorities aren't really, utilizing, they're reaching out to the minority party or allowing them to be involved in the policymaking process, even in cases where they don't have to. As to your question about whether there are spillover effects, that's a reviewer did ask me to look into that. And I didn't find any evidence of it when I tried to see if there was any greater levels of bipartisanship and on other types of issues in the states. I don't think that means that that's necessarily not true. It could be on certain bills you actually do see that spillover effect happen. It might just be kind of a difficult thing to find if you're looking at the overall data, because there are so many non-controversial bills, and trying to identify the ones where you would expect this dynamic to play versus one where you wouldn't expect that to play. That can be difficult. And part of the challenge we're facing in this current paper too is as Jim mentioned a few times, the issue really matters. The fact that we've seen filibusters on the issue that I highlighted, abortion. I don't think that's that's because it's abortion. And if you're going to save your filibuster and your ability to obstruct for one type of issue, it's probably going to be something that's pretty hot button like that. Right. So, but yeah, that would be a fascinating thing to look into later. And I take the point well.
Right. Thank you. And I'm afraid we are just about out of time here. But before we go, I do want to also mention that Senator Carl Levin, the namesake of the Levin Center, was an outspoken defender of the filibuster in the U.S. Senate, as an important way to give the minority voice. And in 2020, he wrote a Washington Post op-ed to that end, which I am sure will be of interest to some of you. At any rate, we are coming up now on another break in our symposium. Thank you to you both for sharing your thoughts with us. We'll be back here at the top of the hour, 2 p.m. Eastern Time. After the break, we'll enjoy a roundtable with academics and practitioners, and we'll be joined by the inaugural State Oversight Academy Oversight Leader. So stay tuned. We'll see you all back here at the top of the hour, 2 p.m. Eastern. Thank you very much.
Well, good afternoon, everyone. For those of you who were not with us earlier, I'm Jim Townsend. I'm the director of the Levin Center for Oversight and Democracy. And I'm so glad you have joined us for this second annual State Oversight Academy Symposium. I have the pleasure of serving as the moderator for this afternoon's roundtable discussion entitled Legislators and Academics in Partnership. The goal of this symposium overall is to build on the progress we made at our first symposium, where we wanted to bring together lawmakers and scholars who study legislatures together to get them talking, to get them exchanging information about their goals and the challenges that they face. And this year, we are hoping to take that a step further and focus on identifying and fostering partnerships between scholars who study state legislatures and lawmakers themselves. What opportunities are there for collaboration between lawmakers and scholars who study state legislatures? What steps are necessary to get some of these partnerships underway? To discuss this topic, we have with us we have with us 2 academics and 2 legislators, and maybe a third who will join us later. Our 2 scholars participated in our morning session, so I'll just introduce them very briefly. We have with us Chinnu Parinandi, who is Associate Professor of Political Science at the University of Colorado Boulder, and Margaret Townsend, Professor of Political Science at Wayne State University and Academic Director of our very own State Oversight Academy. So welcome to the 2 of you. Our 2 legislators are Senator John Arch of Nebraska and Representative Ben Bowman of Oregon. And if I may, I'd like to just introduce, say a few words about their backgrounds. John Arch represents the District 14 in the Nebraska legislature, where he currently serves as Speaker of the state's unicameral legislature. Before his election to the legislature, Senator Arch served in healthcare administration for over 30 years, most recently as Executive Vice President of Healthcare and Director of the National Research Hospital and clinics at Boys Town. As the CEO of the hospitals and clinics, John was responsible for all Boys Town healthcare services, including 2 hospitals in Omaha, outpatient clinics, behavioral health services, and research operations. So John brought an awful lot of experience to roles he has served in the legislature, particularly where he has served as vice chair and then chair of the legislature's Health and Human Services Committee. Ben Bowman is the state representative for House District 25 and majority leader of the Oregon House of Representatives. He is also the director of student and family sports at Gladstone School District and co-founder of OR 360 Media. Before joining the legislature, Ben was the chair of the, I hope I pronounce this correctly, Tigard and Tualatin School Board and the Innovation and Partnership Strategist at the Oregon Department of Education. Ben graduated from the University of Oregon and earned a master's degree in education policy from Stanford University. Well, welcome to you all. I'd like to kind of kick things off with a couple of introductory questions. And I'm going to start with our lawmakers, and then I'm going to ask our scholars some questions as well to kind of get us going. I want to ask some questions to sort of give us a feel for the issues and challenges that you're facing in your respective fields. And then, you know, we can get into some opportunities for collaboration that might help each of you tackle the concerns that you're facing. So to our legislators, I want to ask you about how you're approaching legislative oversight, how you're approaching your roles in trying to advance legislative oversight. So to start with, what have been your priorities? What are the issues that in your 2 states you've been most focused on from an oversight perspective? And what is the structure that you've got in place right now that allows you to pursue oversight? So I'll go alphabetically. Senator Ash, would you like to start out?
Yeah. Can you hear me fine? Is my microphone open? All right. So we're in a bit of a transition right now in Nebraska. I would describe what has been our I would describe our current structure as fairly reactive. We have over the years have responded in large part to crises where we would set up some type of oversight to make sure that never happens again. And that's how we've been running our oversight over the years. So we have a performance audit committee, and there is a committee of the legislature where there is a performance audit staff. They are tasked with really reviewing a few areas that the committee identifies each year, asking this question of our programs accomplishing what was intended. And so they go in and they receive information from the departments and then write reports and answer that question on a handful of areas each year. And then we have 2 IGs, one for corrections and one for child welfare. Those were established over the years in response to crises. And so there was a particularly violent offender that was released from corrections who went out and created more violent crime. And how can this happen? And so the IG for corrections, we had a crisis in child welfare in foster care review. And then we set up that IG. So that's how we've been running for a number of years in Nebraska. And I say all was not going real well. I personally have chaired 2 oversight committees, 2 special committees one in the area of a youth rehabilitation and treatment center, which is a Department of Health and Human Services service for kids that are coming out of corrections. And there was a big program meltdown there, and we did an oversight committee specific to that. Another one in the area of child welfare privatization, in case management privatization, another big meltdown, and I chaired that committee. We came out with some results there. This year, the Attorney General of Nebraska issued an opinion that said that the 2 IGs are functioning in an independent manner from the legislature and believed that they were not constitutional in how they are structured. That has created a bit of a crisis in Nebraska. And so I am now chairing an interim study in an attempt to put a structure into place that is more proactive than reactive. And we can take a look at some of the issues on a monitoring basis and not just a past auditing basis in investigation. So we're in process right now where this interim study is a big part of what we're doing with oversight. So that's a little bit about what's happening in Nebraska.
Ben?
Yeah, thanks, Jim. It's a good question. So Oregon is a citizen legislature, like most states in this country, meaning all of our members are either retired or have some other job or career that they do. And this creates a pretty significant structural problem when it comes to something like oversight, because we come together during the legislative session, and during the session, everyone's trying to pass their bills, they're working the session, and then the session ends, and they got to get back to their day job, and they got to get back to their family and their other responsibilities. So we do have some culture or some structures built in. The speaker mentioned some in Nebraska. We've got some similar ones. We've got a joint audits committee. We've got budget committees for specific policy areas that have sort of KPIs built in that they're supposed to be evaluating. But what I have discovered in my first couple of years here is that the structure matters, but the culture matters even more. And we don't have a very strong oversight culture in Oregon. In fact, Jim and I were chatting when we were prepping for this call, and Jim categorized three sort of job duties of a legislator. There's legislating, making the laws. There's representation, being a voice for your district and accommodating their needs. And then the third category is oversight and actually ensuring that implementation is going well and that the government's delivering services. I feel like in Oregon, and I would venture to say probably most states, legislators focus on those first two buckets, and that third bucket is not as much of a muscle that they're using and thinking about. We do have some one-offs in Oregon, right? If you've got a committee chair who cares a lot about something, we have a state senator who cares a ton about child welfare issues. She's calling oversight hearings. She's doing tours of facilities. She is hauling people before her committee. She is sending public information requests to agencies. But those are one-offs. It's not built into how we do business, and it's not often what people conceive of their job as a legislator. So that's kind of where we're at in Oregon. What I'm trying to figure out is how do we create the adequate structures, but also have people reconceive of what their job is as a legislator and have accountability as built into that conception.
Well, that's a great setup for our conversation this afternoon. I guess I'd like to come back to a few questions, more detailed questions, but I'd like to turn to our two academics and ask you about your research and your research agendas and what you're working on. Give us an insight into what you're focusing on when it comes to state legislatures and state legislative oversight, and how that differs from the work you would be doing if you were examining Congress. What kinds of challenges are specific to conducting research on the state level as opposed to the congressional level? And Chinnu, why don't you go first?
Great. So this is a great question. I'll start with the big challenges, and then I'll talk about my research and how it deals with these issues. So one of the huge challenges that you have to deal with when you're working at comparing states and outcomes across states, I presented on opioid deaths earlier today, is that the states have different data limitations, data gathering issues. And so what typically happens is that if I'm gathering data for 50 states, I'll end up with 38 or 39 states where I have reliable data over time. They're going to be different states for various idiosyncratic reasons. And that makes cross-state analysis quite difficult. Another issue is that a lot of oversight happens in unmeasurable instances, right? So like earlier today, I presented on how Pennsylvania has by statute a requirement that the State Board of Medicine has to appear before the Pennsylvania legislature 4 times a year and talk about enforcement of doctors with respect to prescribing behavior. Now that's easy to measure because it's in statute, but what about all of those informal meetings where a standing committee might meet with a board of medicine, or phone calls, or various instances? And I think this is to Ben's comment about culture. What about all those instances where oversight happens in unmeasurable ways that might be meaningful? In terms of my research and where I am, one of the biggest challenges is the citizen legislature versus sort of like viewing being a legislator as a full-time job, and how those differences impact the ability to oversee. There are benefits to having a citizen legislature, right? You want your legislature to reflect the people, the electorate, and you don't want to have like one might argue you don't want to have a permanent class of politicians that are not representative of the people that they are elected to represent. But if oversight, and this is an empirical question we don't know about, I think, if oversight is better, if legislators are able to devote more time to it, and if legislators can't devote more time to it because of the other job responsibilities of being a legislator, as well as not being in legislative office year round, how do you augment sort of the resources that legislators have, either through staff, through like AI applications? There are various different ways that this can be done that can lessen their workload. The last thing I'll add is that the black box from the academic side is the role of the executive branch, right? Governors matter a lot more in states that have term limits. Governors matter a lot more due to citizen legislatures, right? And so how do we meaningfully capture the relationships between legislators, governors, as well as the executive staff that answer to both the governor as well as legislators?
Oh, you brought up a whole host of issues there, as you know, that I want to follow up on in a little bit later. But Marjorie, please give us your perspective.
Well, I couldn't agree more that doing research about the states is much, much harder than doing anything with respect to Congress. There's a famous book, Pev Squire was involved in it, called 51 Governments. And what you really have to think of with the states is you have 50 different governments. And the 51 is like, yeah, there's the federal government too. But you know, if you think about it, state legislative scholars are trying to look at 50 governments. And I knew that at a, you know, sort of a intellectual level. But when we did the 50 state study, I was overwhelmed, blown away, whatever superlative you want to put in there, about just how different the states are. And there were things that we just had no idea. Most of us know our own state and maybe a few others that we've used for comparison and things. But we started discovering this business where some states mandate, sometimes in their constitution, that their oversight committee specifically has to have equal membership from the two political parties. And I mean, we hadn't ever looked that closely at that. And what we found, one of the states that we found actually does a pretty good job on oversight is Idaho, which is a small citizen legislature, but they have a bipartisan oversight committee. It says in their constitution, you must have X number of Democrats and X number of Republicans. And we sat there and joked about what are they going to do sometime when they don't have that many Democrats in the state legislature, you know, because it's in the Constitution. You got to have them on the committee. But in talking to the people in that state about how that works, the minority party is able to get issues dealt with in a trifecta state, you know, the completely very red dominated state, but they get their concerns listened to. They get their issues on the docket for the committee. The reports are, and the investigations are conducted that involve their issues as well. And we found just some amazing bipartisan good government stuff in some of these states. But until you start digging into it, there's just so much in terms of the differences that you miss variables that are likely to matter.
So what I'm hearing you say is both Chinnu and Marjorie is that, there's a great deal of, obviously, data is the, coin of the realm. It's what you most need to do your work. And in many cases, it's very difficult to access. And you've got so many states to work with, which of course can be a rich opportunity for comparison, for learning. But at the same time, a lot of times the records are not as available or they don't even exist. Congress obviously has a congressional record that at least records everything that's said on the floor. And in many cases, a lot of the committees capture a lot of the information that's produced by their committees. In a lot of states, that's not nearly the case. For those who are not familiar, the 50-state study that Marjorie is referring to is the study that she and her colleagues did for the Levin Center a few years back, looking at oversight in each of the 50 states. And it was really an inspiring piece of work that taught us an awful lot, but also taught us that we needed to do a lot more to continue to build access to information and to update that information. Chinnu, your comment about part-time legislatures and the challenge of doing oversight puts me in mind of something that I'd be interested to hear what our practitioners have to say about this. We tend to think, and your study looked at the legislative resources overall and a relationship between greater legislative resources as you defined in terms of more budget, more greater salary, and greater time, longer sessions. But I wonder if it wouldn't be productive to also consider sort of a situation where a part-time legislature exists, but there is a decision to invest more in staff because it's a part-time legislature, on the theory that part-time lawmakers, citizen lawmakers, as Ben was describing, have a very challenging situation in being able to balance their service with their careers and their personal lives. And perhaps that's an argument for advocating for allocating more resources to staffing these part-time legislatures in some form or fashion, so that they can do the work that they need to do. Senator Arch, what is that? What do you think about that idea? Is that something is that a dead letter? Adding more staff and doing more to provide staff support to what you're trying to do in Nebraska?
No, as a matter of fact, I think that's probably the direction we're going to go. And it's not necessarily more staff. I think we have staff right now. We have our IGs. We've got a pretty robust group of people that are looking at these issues. I think it's more the coordination with our standing committee chairs. In other words, Judiciary, HHS, if we've got an IG in corrections, if we've got an IG in child welfare, how does the chair view their relationship to those IGs? And this is going to be part of our interim study is we've got some choices as to where this information flows. We've got an exec board. We do not have an oversight committee established. I'm not sure that the legislature is going to want to go to a standing committee of oversight, but perhaps the exec board, certainly, but then these committee chairs. So the information, if you're gathering key indicators, key performance indicators, and you're seeing trends occurring, you're monitoring trends, and you see that room seclusions, for instance, are going up, or whatever the indicator might be, or injuries of staff, or whatever, it is fed to then the committee chairs who then step it up. They make a phone call. They bring somebody in to brief the committee. What are you doing about this? We're seeing these trends occurring, that type of thing. Now that I would say will require some new thinking on the part of the committee chairs. I'm not sure that they view their role in that way, but it doesn't have to be a full-blown subpoena. It's just come in and tell us what you're doing. And there may be a very, very good reason that room seclusions are going up. But the legislature ought to know, because if there is nothing to address that, or if we're heading into a crisis, let's get ahead of it now with some policy changes. So again, I'm not sure that it's additional staff, but I think it's really the court for us. I think it's going to be more the coordination of the information that the staff is already gathering. And now the committee chairs or some function needs to take that on and get more information, talk to the executive branch, talk to the department heads, and find out what's being done about that.
Ben, what are your thoughts?
It's a great question. So Marjorie would be pleased with us in Oregon because we have an oversight work group that has 3 Republicans and 3 Democrats on it, and we are exploring some options, and we're actually looking at both. So part one is at one point in Oregon, apparently we had budget authority to hire legislative branch performance auditors. And then COVID happened, and then they weren't in the next budget, and things happen, people move on. So we're interested in sort of expanding the branch's capacity. And then to the speaker's point, we're also talking about giving some specific directives to our existing legislative fiscal office staff and legislative policy and research office staff, asking them to engage in a little bit more of what might be considered oversight. I would say this actually might be one of those great opportunities for the branch to partner with higher education institutions and researchers and professors who are actually conducting research about outcomes from agencies that the legislature wants to conduct oversight in. I'm actually, as we speak, in Charleston at a majority leaders conference, and one of the big agenda items that we've been discussing is balance of power. And I actually think this conversation is as much about co-equal branches of government as anything, because to Chinnu's point, we are outgunned in the legislative branch. We are a tiny, tiny branch compared to a massive executive branch. And frankly, with the citizen legislature, I don't think that we can be co-equal unless we've got full-time professional staff who can help us sort of punch above our weight class.
Mm-hmm. I want to keep this conversation going, but I want to turn to our scholars and see if you have any, are there any sort of things that you might classify as myths or things that people think about state legislatures or legislative oversight that are not true, or that you think you have big doubts about, that if you had the resources, if the data were available, that you'd be curious about trying to use your capacities to debunk or to clarify?
I'm happy to take this first, if that's okay. So I think
Sure.
one big myth, and this is based on a similar conversation that we've been having, is that part-time legislators somehow do less work or have less responsibility than full-time legislators. I don't know what the historical, Pev Squire was mentioned earlier, the historical roots of part-time legislatures were born a long time ago, but the docket of what legislatures in 2024 have to do is immense, right? And even a state like Colorado with 5 or 6 million people, I mean, it has a massive economy. The Colorado legislature has to do lots of things. It has to coordinate issues with Nebraska and Wyoming and neighboring states as well. And this falls to legislators and their staff. And so I think the biggest myth is that. I think the other big myth, and maybe this is a myth that I get from undergraduates, is that the states don't matter as much as the federal government. I think that in an era of federal dysfunction where Congress can't do even the most fundamental tasks, the state governments matter more, if not less, than they ever have.
Marjorie?
Yeah, I totally agree with those points. The other thing that I think is a myth and maybe more in the public perception, and maybe incoming people running for state legislature, is that the key thing they need to do is introduce bills and pass legislation. And there's a lot more to the job, as we've mentioned throughout the morning and now. But the constituent service was one of the things mentioned this morning, but also the reading of reports, that dealing with information, trying to get your mind around the, drinking from the fire hose of information that comes at a legislator. And it's a phenomenally difficult job. And I think people think, oh, you can just run and you shake hands and you raise money and you sponsor these bills and people put tons of bills in the hopper. And, where's the actual performance evaluation reports and all of that sort of thing that really makes government work? And, who's paying attention to that part of it? And it's not public, it's not glorious.
Jim, can I add one thing?
Please.
So I bought this book forever ago, but I started reading it on the plane ride yesterday. It's called Recoding America by Jennifer Polka, who I know works with the Levin Center pretty frequently. It's part of why I picked it up. The one myth that I think was in my head that Polka talks about in the introduction to the book actually is that oversight should be one way, that oversight should be done to an agency rather than it's a two-way conversation. She talks about how like the elites of our society do policy and politics, and then the people who are below them are the implementers, which in a digital world is especially problematic because the sort of elites doing policy don't actually understand the dynamics of how technology works often on the ground. So I thought that was a really interesting sort of misnomer, is like she was basically saying oversight needs to be a dialogue, a give and a take, a compromise where the policymakers are listening as much to the implementers as sort of like telling them what to do or holding them accountable. I thought that was a useful framework for thinking about oversight.
Well, Ben, we are huge Jennifer Polka fans. We think she's opened up a lot of interesting topics and has explored through her own excellent writing and her experience some awfully important topics for governance overall. And what your comment makes me think about, and is something I wanted to bring into this conversation, is a myth or maybe a misunderstanding. So often, I think oversight is viewed, legislative oversight, congressional or state legislative oversight is viewed as this, like you suggest, like this attack on the executive branch, or it's a confrontation with the executive branch. And while sometimes confrontation is maybe called for, what really is happening is that it's oversight of people doing oversight. That the legislative branch, as you mentioned, has limited resources relative to the executive branch. And so it can't do the level of oversight, in many cases, the kind of oversight that Jennifer Polka suggests, this oversight that's deeply involving the users of government services, really getting insight into how people experience government with an eye toward improving that experience. But what legislators can do is, first of all, write laws and oversee the enactment of regulations that call for that kind of research, that call for that kind of attention to implementation and to the experience people have with government. So that maybe the way to think about oversight is that it's a kind of tiered process where, the lawmakers are really, Marge, is kind of, as you suggest, looking for data. They're looking to make sure that these agencies are gathering the right information and then acting on that information, and that they're acting as a check on that process, as opposed to, having to be the ones who are on the ground gathering a lot of the primary information, if you will, from people. Obviously, the constituent service can be a way to gather directly, information from the public, but in general, I think their role is kind of as a second order of oversight that's holding accountable the oversight and management that's going on in the executive agencies. Does that I would like everybody to kind of react to that. Does that make sense? And if so, is there a research agenda around understanding that process better? Because I don't think people understand it very well.
If I could make a comment about that, I think it goes back to the purpose. Why is the legislature exercising oversight to begin with? And in the three-branch government that we have, our role is to legislate. It is to policy. We need to know in order to effectively legislate. we had an experience, and I mentioned I chaired a special committee where we have a youth rehabilitation treatment center that I would only describe as having a meltdown. That's probably the best way to describe it. It absolutely melted down, programmatically, facility, all the way around. So the legislature, with the Department of Health and Human Services that oversees that service, we conducted a series of hearings and a series of just meetings where we got people in a room and said, what happened? And as it turns out, there were some things that only the legislature could do. We had, for instance, more of a dorm style facility in a very old facility that was not conducive to program. It was much more correctional than it was treatment. And so as a result of that, the legislature stepped up, appropriated funds to create more of a cottage setting for some of these youth. And, so it's that kind of partnering with the executive branch that is what should be happening in all of our oversight if we all have the same goal. And it was mentioned good government, which is certainly our goal in the legislature. We want good government. We want good programs. We want effective use of our dollars, all of those things, which when you partner with an executive branch that wants those same things, I think it works very well.
Just one quick comment sort of on this general theme. Some of the places that we found, the states that we found that seemed to be doing very effective oversight had reporting requirements built in to their processes, or sometimes statute or constitution that required that the Auditor General's reports received a public hearing. And so you have limited Auditor General resources, and they only put out a small number in most states of reports a year, and sometimes joint committees so that they didn't have to do it the same dog and pony show twice. But to present that to the legislators, let them ask questions about the actual investigation, the report, and then if they wanted to call in some people from the executive branch, hopefully with, as John says, in a more collaborative, constructive fashion rather than a gotcha, sort of political gamesmanship. But then they also had a process where they had to report to the public at the end of the year in a legislative report. Here are the reports that we held hearings on. Here was the problem that we identified. Was it actionable by the legislature or not? And then here's what we did. And sometimes it was a bill that got stalled, between one of the two chambers, but sometimes that comes back up and gets passed later. But it was a public reporting of the legislature saying, we're doing oversight, we're using the money from the auditors, investigations to good effect, and we're actually taking action. We're not just relying on the auditor to talk to the agency and try and get them to comply. And those were some of the states that I thought were doing a pretty good job relative to, to some of the others.
I guess I'd like to pick up on the on your comment about audit agencies and other, what we call analytic bureaucracies that that serve to while they provide resources to extend the ability of they can provide resources to extend the ability of a legislature to do oversight. I guess I'd like to know from Ben and John, how have you seen these agencies work in your states, and if you could, do you feel like you're getting what you need from the auditor or from other legislative analytic bureaucracies that are supposed to be helping you do oversight?
Yeah, that's a good question. So in Oregon, the Secretary of State, which is an independently elected office, also technically Oregon's lieutenant governor. They are in charge of the audits division of the state. So they have a whole team of auditors whose job it is to audit state agencies. And they have an audit schedule where they go through and will do like gigantic audits of these agencies and produce recommendations. And I think that's incredibly useful, and they play a very important role in the state. There's two challenges that I can think of for why I think that's an incomplete oversight mechanism. One, most of what they do is on a schedule. So it is not responsive to a scandal, a newspaper article, a problem, whatever. It is sort of planned at a time. Useful, but sometimes you need the other thing. Sometimes you need, I think the Levin Center used the police versus firefighter, on the beat police officer versus like emergency responder firefighter.
Yeah, we didn't invent that, but yes, we used that's a scholar. I'm sure our scholars can cite the folks that first put that forward. But yeah, we find that as a useful framework.
It's a useful framework because you need both. So that's one. Two, it's a different branch of government, right? Which I also think is problematic. I think the legislative branch itself actually needs capacity to conduct the oversight that it wants to do on behalf of the people. But what we've talked about in our work group is if a state agency has been audited in the last couple of years, every audit comes, in Oregon at least, with a series of recommendations. And the agency responds to each of those recommendations. They'll say, we plan on doing this. We're already doing this. We don't think we should do this. Here's why. That often doesn't show up in the conversation in the legislature. It often isn't part of our budget conversation, for example, when that agency is having its budget reviewed. So what I've chatted with one of our candidates for Secretary of State about, and some of my legislative colleagues on both sides of the aisle, is why don't we build a tighter handoff there between the audit findings in the Secretary of State's office and the budget committee that's reviewing the budgets of that agency, so that at least there's a conversation. Hey, 2 years ago, you said you were going to do A, B, and C. Give us an update. What's going on? What challenges are you encountering? What's working? And that's another place where we're talking about asking our legislative fiscal staff to tell the agencies prospectively, these committees are expecting you to report on your audit progress as part of your agency budget overview. So those are a couple things we've been talking about incorporating our analytic bureaucracy into our budgeting process. But Mr. Speaker, what about in Nebraska?
So similar, we're not in the Secretary of State office, but we have a constitutional officer, a state auditor, but independent. So that state auditor goes out and identifies their own projects that they're going to be working on. They go out and conduct the audit. They produce their own report, but we have the same issue, and that is a bit of a disconnect between the legislature and that office. And so good information, but then again, we're back to does our committee chair, do the committee chairs see that as part of their role? Other than, no, that's the state auditor, well, that's interesting, but that's the state auditor, and the audit results then just sit there. And so I think part of our challenge in all of our states is we have a wealth of information that's flowing. People are looking at everything and digging in deeper and writing reports. Every bill that comes out has some annual report required, and pretty soon overload, just tilt. How do you make sense of all of this information? And I go back to my days running the hospitals, and this was an evolving process within healthcare where it moved into a performance improvement process where you had this regular monitoring of KPIs, and you had the green, red, yellow indicators that would flag certain areas that you would then want to go and audit. And then you would have those events where you would do a full-blown investigation into how in the world did this happen, in our hospital. So you had both of those things going. As I mentioned earlier, in Nebraska right now, I think we're heavily weighted to the crisis. We're heavily weighted to the incidents, and then it's post-mortem. The patient has already died, and so now we're going to go back and investigate all of that. Well, great, but far better if you can get out ahead of it and you can see a red flashing light that says you got a trend going on right now that both the executive branch and the legislature should be very concerned about. Let's sit down and work on that problem.
Mhm. You know, what you just mentioned, John, I think is something that's awfully important. I'd like our scholars to talk about this as well, which is you mentioned a wealth of information. There's a tremendous amount of reporting that is required right now. A question that often occurs to us at the Levin Center, though, is what is done with these reports, and to what extent are the reporting requirements really helpful in terms of either preventing waste, fraud, and abuse, or just improving management of government programs and ultimately improving the public's experience with government. Ben, when we were in Oregon a few weeks ago talking with you and your colleagues, one of your colleagues mentioned, the same thing that John just mentioned, which is that everybody's got a report. We're constantly requiring and putting in new requirements for reports. I'm just wondering what our scholars think about a research project that might look at the efficacy of these kinds of reporting requirements and whether they are really aligned or doing any good or correlated with any kind of outcomes that might, that we might identify as good outcomes for oversight. Does that sound like a good avenue to go down, or something that you might have the data to pursue? Marjorie or Chinnu, whoever wants to jump in.
I think just not to completely sidetrack what you're saying, but I think the missing step from both the legislators that I'm hearing is the one that I was mentioning, where if you can't hold hearings on all these reports, and it might be valuable to try and figure out how important it is to have all these reports, but the few that the auditors really dig into every year. And when we looked in most states and we highlighted performance evaluation, and we looked, for the kind of deep dive kinds of performance evaluations that were done. If you published and made it very public to the media and to the voters and to everybody in the state, here's the report, here's what it found, here's what we did, then I think it starts to build that culture that people have mentioned all day about oversight's important. We're reporting to the public that oversight is important. And we have metrics that tell us X legislator was involved in this oversight. They took action to protect your tax dollars. And some of it's very inglorious, good government, mundane reality kinds of things that are not going to get coverage unless the legislature highlights it for people so that it's more public. Now, sometimes there might be situations where the legislature doesn't want to admit. We happen to live in a state where they might not want to admit how infrequently they have considered in committee hearings oversight reports. But, that should be something that if a legislature is doing it and doing it well, they should be broadcasting that from the rooftops so that voters understand this is part of the job, it's important, and we're doing it. And so I think that last step is what I'm seeing fairly infrequently.
Chinnu, what are your thoughts?
So I'm going to speak first to the question about whether we have the ability now to conduct the types of studies that I think you're leading toward, which are how do these reporting requirements lead to better sort of government outcomes or governance outcomes? I think that we now have that ability. I think that computing advances have finally, maybe they've happened in lockstep with the diffusion of reports, but we have the ability to sort of look at the number of reporting requirements and use statistical analysis to see whether that's improved governance. Now, those studies don't really exist across different policy areas. I'd add that we should probably also look at the content of the reports, right? It's not just enough to look at the reporting itself. And we have sort of like text as data advances on the computer science side that allow us to do that in a much more nuanced way. The thing I would add though, and maybe the policymakers can correct me if I'm mistaken, is that maybe the reporting requirements do, or maybe the huge increase in reporting and the reporting requirements do serve a benefit insofar as they inform the public about oversight. And maybe they create, right? Because if the public doesn't buy in, then it's really difficult to, it's important to do, but it's difficult to sort of justify doing in the same way. And so I think it's important to identify both in an education way as well as sort of in a kind of like a public interest way that these reporting requirements do serve a public interest. And I'd add that, like, I was discussing recently how the Supreme Court adopted a code of ethics recently, and very few members of the public even know that this is a thing. And of course, the Supreme Court has low approval rating right now, and their approval rating matters for like legitimacy purposes. And so I'm wondering whether public outreach to the public about reporting requirements could be useful to build an additional case for accountability.
I think that this is a very interesting conversation. I think one of the challenges, I think sometimes requiring a report is done because that is what we think oversight means. We require people to report back to us with no sort of plan for what we do with that information. I'm skeptical that much of the public is using this information, although I do think particular interest groups or membership associations will use that data for their own purposes, which sometimes can be a useful part of the process. And, you know, in Oregon, we have a Medicaid delivery system we call it CCOs, Coordinated Care Organizations. And there was some statistic, I'm going to butcher the statistic, so this isn't right, but it's basically like if you add up all the reporting they have to do, it's like one report every 6 hours or something like that, between the federal and the state requirements. And so I think like the challenge is, what is the necessary information that is actually going to be actionable and useful to policymakers? And how do you acquire that without just, you know, every time it's like you pass a new program and agencies are saying, well, here's the cost, and half of that cost is paying for bureaucrats to be able to report on the information. So I do think we may have actually gone a little too far in some of our reporting requirements, but the balance is a tricky thing to strike for sure.
Sorry, I was struggling to get myself off mute. I think these are excellent points, and I think in some cases, the legislature, whether it's Congress or the state, have got to be making sure that what they are requiring, oversight functions that they're requiring, are properly resourced. In a lot of cases, agencies struggle to meet these requirements because there's no additional there are no additional resources provided to fulfill those requirements. I want to recognize Representative Patricia Serpa, who has just joined us. And Representative Serpa, we're so glad to have you with us. We know you had a scheduling conflict and preventing you from being with us at the beginning, but Representative Serpa is a member of the Rhode Island legislature, and she's going to be with us to receive a designation a little bit later this afternoon. But welcome, Patricia Serpa, and thank you for joining us.
Thank you. I hope you can hear me. I have my fair share of technical difficulties.
You sound great.
Okay, thank you.
You sound great. We can hear you well.
Thank you.
Well, I think what we'd like to do is pivot now to sort of some brainstorming around ways in which this whole theme of partnerships, of enabling scholars and practitioners to work together can really come to life in the future. And so I know, obviously we've been talking kind of on a wide range of topics that have both research implications as well as implications for how practitioners go about their work. so I just wanted to see if we could maybe just talk about a few ideas that we've shared with each other when we were preparing for this, and just sort of see where the conversation takes us. One of those questions has to do with the idea of how to elevate. This is something, Margaret, you were just talking about, and others have talked about, ways in which we can elevate and get the public and get lawmakers themselves to see that oversight is really something that is a thread that really should be going through all of their work. That it's a distinct function, of course, of being a lawmaker, but that it really affects their ability to represent their constituents and their ability to make good law. And so I guess I'd be interested to hear from all of you, your ideas about either research that can be done, or a way in which we can learn more to understand what might work in elevating the importance of oversight in the public mind and in lawmakers' minds. And then maybe some practical reforms or some structures that we could create that would do that. So I'm just I guess I'll start with John Arch. Do you want to start just giving your thoughts about this, about the sort of the practical side, or any research ideas you think need addressing?
Sure. Yeah. Again, we're going through this right now and trying to figure out what our structure should be in Nebraska. I keep going back to our standing committees. We have standing committees that have content knowledge. They obviously have authority over certain subjects. I'm hesitant to build in a parallel structure within the legislature that kind of runs as not in opposition, but rather maybe I don't want to duplicate what the standing committees are doing, or in some cases should be doing more of. And I know as we're in a biennium in Nebraska, we're in our second year. And so coming up now, in January, we're going to have new chairs and new committees and all of that. We have term limits. And so we only have 49 senators in the entire legislature in Nebraska, that we're a one house. And we'll have at least 15 new senators coming in next year. And so it's an opportunity to kind of hit reset for the committees as well as the committee chairs, and maybe structuring more of what may not be a hearing on a bill, but maybe a standing briefing that needs to occur within each standing committee, and begin to build that into the duties of the committee chair. So they begin to see that as their responsibility for oversight, and not have I'm not responsible for that. That's the oversight committee, or that's this performance audit committee, or whatever. Perhaps it should be more of an ongoing responsibility of each of those committees in their areas of authority. And that's where I'm kind of going as we're considering that within the state, and how to get this built to the culture, as we've talked about, the culture of the organization, that this is just part of what we do. It's not some special thing that we do. It's just part of what we do. It's our ongoing obligation and responsibility.
Ben, do you want to talk about your situation, and then we can ask the scholars for their ideas?
Yeah, well, so when you asked the question, Jim, the first thing that came to my mind, I think Chinnu actually mentioned this a little bit earlier with respect to the Supreme Court. We are at a time where the public's trust in institutions, and the government in particular, is very low. And that's a big problem in a democracy. That's a very big problem in a democracy. And I think to the extent that we can tie for legislators a connection between good, solid oversight and rebuilding the public's trust in government, that's a really important link to draw. And I'm sure there's been a lot of research on that already that I probably am not aware of. But I think if for winning the argument with our colleagues, which is the speaker and I's charge at this point, is trying to convince our colleagues that this is an important priority that we all need to buy into. I think everybody, both parties, every state in this country recognizes that trust is low and that that's a very bad thing, and frankly is an existential crisis for the country. So one of the things we can do, it's not the only thing, but one of the things we can do is have a very collaborative and productive process of making government more effective through oversight. So I think a research link there could be a useful tool to help us win that argument in legislatures.
Chinnu, do you want to?
May I just?
Or,
I'm sorry.
Sure, go right ahead.
I'm sorry.
No, please.
May I just add something to this? And I
Please do.
apologize for joining late. So, the table is set, so I'm coming in midstream. But I'm just surprised to hear that that you're having some difficulty convincing other legislators that this is an important function of government. I'm just surprised because here in Rhode Island, we're a 75-member House of Representatives. We're really lopsided with Democrats. I think there are only 9 or 10 Republicans, but we have not had a problem convincing anybody that this is an important function of government. So it just surprises me to hear that that's work. And again, I missed everything that came before, so I apologize, but it comes as a surprise to me. And I will tell you, after elections, I don't know how it works in other states and how representatives and senators are assigned to committees, but the elected speaker will send out, the list of committees, and you are to pick the legislators are to pick their top 3, and without fail, oversight in the state of Rhode Island, at least, is always like number 1 or 2 for everybody. In fact, the speaker will have to tell people, I can't put you on. And he goes by seniority mostly. I just can't put you on. There's not enough room. So it's just a popular committee here in Rhode Island, at least.
Oh, I mean, that seems like a pretty interesting research question in and of itself. Is how do states vary in terms of their of how oversight committees are viewed? I think it's changing in some states. I know in some states, oversight is almost non-existent. States, the legislatures don't think it's their job, and they don't even have any structures to pursue it. That's certainly a minority, but there are some states like that. I think Marjorie, you can attest to that.
Yes, we found when we were doing the 50-state study.
Yeah,
there are places that have no audit capacity at all. In Indiana, for example, they had a huge scandal with their foster care system, and the governor hired an outside consultant to audit. There was no capacity at all within the state to do it. It was fascinating. I have a question for our elected officials. John, you were mentioning that you didn't want to have sort of a duplication of an oversight committee and then the chairs of the standing committees, the substantive committees, would, maybe not see oversight as their responsibility. I haven't, if my memory serves me, we didn't find this anywhere in the 50 states, but would it be impossible for a legislature to create an oversight committee that is comprised of the chairs and minority vice chairs, not in, obviously that's a 2-party state, not yours, but that would be an oversight committee and that would bring, whatever their substantive committee was finding out to a sort of centralized body. Possibly many states we've found that the joint chamber committees are good because it gets like two chambers looking at it when you had 2 chambers. But, would that be anything that would be reasonable to kind of, I don't know, split the baby,
It's an interesting idea. In our last work group committee meeting in Oregon, our government oversight work group committee meeting, someone mentioned the idea of you have like 1 or 3 permanent members of an oversight committee, but then depending on the subject matter, you bring in the chair, the ranking Republican of the policy committee, and then the chair and the ranking Republican of the relevant budget committee meeting. We don't have any structure like that. Like we don't have any committees where the membership is fluid and changes depending on the content, but I don't think it would be impossible. I just think it'd be a little logistically challenging, but doable. John, do you guys have anything like that in Nebraska?
No, we don't. I would say that, again, as we're considering what structure we want, I would see a division of the legislature, and now I'm talking about staff, not a committee, but a division of the legislature having the oversight responsibilities. And that's where the staff resides, and all the divisions of the legislature report to the executive committee, so of the legislative council. So the executive committee is technically that oversight committee. And so this is going to be a discussion whether to create a separate oversight committee, whether you use the executive committee along with those standing committees to perform oversight. Again, my hesitation is simply that I don't view oversight as a separate function of those committees, and to take that out of the committee and create it as a separate function, that's the only thing that gives me hesitation.
Chinnu, did you have anything you wanted to add while we're on this topic?
Yeah, I'll speak to the question that you raised earlier about how to foster more collaboration between researchers and elected officials. And I have 2 points to make that are both placing the burden on the researcher side, because I can't speak to the elected official side. So the first thing is, when I was in graduate school, I had the opportunity to intern with a state public pension system in Ohio. And I learned firsthand the value of embeddedness, right? So it's one thing to study oversight and the effects thereof from on high and gather data sets. It's a totally different thing to observe politics in action and policy making in action, right? So in Ohio, for example, there's a legislative service commission that consists of legislators as well as like nonpartisan fact finders and appointed heads. And to see these people work together really helped to, I think, solidify what oversight means, both in terms of revising or reviewing law, but as well as in terms of day-to-day implementation. And I think that having more researchers involved in those sorts of activities would vastly improve the value added that we can provide. The second thing I would add here is sort of an attack on kind of the promotion guidelines at universities, especially like the heavy research universities. Having gone through tenure this year, I was shocked to learn that like almost all of the incentives for us researchers come from publishing in peer-reviewed journals, and that's great, and we're adding value to theory, but there should be more emphasis placed on, and the elected officials here, I can say that like the Board of Regents are appointed by governors and blessed by legislators, so you have some involvement in this. I would say that like there has to be more emphasis placed on research that benefits the public interest, and that need not be a zero-sum game where taking away from peer-reviewed publications necessarily is going to like doing one doesn't take away from the other, I should say. But the incentives that researchers face should be changed maybe slightly.
Couldn't peer review, I mean, couldn't the studies that are generated by that focus on practice be still peer reviewed? I mean, why
they could be. They could be, and Marjorie can probably speak to this as well. Sometimes what the peer-reviewed journals, like in the theory, are chasing, or what they want, is not necessarily the kind of like the grinding questions of oversight. Now, there are moments where they're on the same page, but they're not always.
So it's really, and this is something we've come to understand as we work with so many scholars, both at Wayne State and then all over the country, that there's great pressure to be in certain journals, right? It isn't always, I think that's what you're saying, is that some of the journals that are very influential to somebody's career are ones that might not necessarily be on the same page, wanting theory as opposed to practice, or insights into theory as opposed to insights into practice.
That is spot on.
Yeah.
Absolutely. And the whole, you can say that it can be peer reviewed, but the reviewers are embedded in the academic system and they've bought in because they have risen up through those ranks. It's a culture kind of thing, like we've been talking about with an oversight culture. The respect for a report, like the reports that we do through the Levin Center, those are not publishable.
Right.
And so, but they're valuable, probably more so to the general public and to legislators than anything in the peer-reviewed journals. I went many years ago to one of the American Political Science Association meetings in DC, where they had people from the federal government come in, and they said, they had practitioners, they said that the only thing that they found useful out of the entire field, and for those who've never been to the American Political Science Review things, it's hundreds and thousands of papers and so on. The only thing they found that was useful was our research on presidential transitions, because people only do that once and we are able to tell them something they don't know. And other than that, everything we do is useless. And it was like, it was stated that bluntly, and it was very depressing because I was in the tenure process at that point, having to do things that would be publishable. And it felt like, then why am I doing this? If, you know, if the people involved think it's useless, what's the point? Other than to keep my job, which I managed to do.
Pretty important. I'd love to get some feedback from our three practitioners to Chinnu's two ideas, starting with his idea about encouraging scholars to become embedded in governmental entities, whether that's legislatures or executive branch entities. What do you all think about having scholars in-house, or having a rotating system, or having some system whereby scholars can come in and be part of your operation?
I think that's doable, but of course, again, you know, to the discussion of academics, it's probably not going to be publishable. You know, it's not going to accomplish what a professor may need in their own career, that type of thing. It may provide us with information, and I'll give you an example of that, because I've been doing a lot of thinking about what, you know, at the 30,000 foot level of where we are in legislatures, we have to decide, how are we going to spend our time? What should we be looking at? We could look at everything, and there's so many areas that need attention, and we could spend time, and we could send staff, and it is absolute whack-a-mole. So we have to step back and say, you know, where should we prioritize our oversight time? Now, when I was running the hospitals, the Joint Commission told us, you know, our accrediting body, that here's what you do. You look at high volume, high risk, and problem prone areas. That's where you spend your time. Well, to the legislature, we could probably translate that a little differently and say, like, okay, where do we have substantial risk to people? Where do we have substantial risk to finances? You know, fraud and abuse. Where do we have substantial risk to people? Corrections, you know, your high risk populations, your child welfare, you know, is that where we should be? Is that where we should be spending our time? And then perhaps there is an opportunity to even standardize across the states. What are those key performance indicators that we would want to be looking at within those high risk areas? And that type of research could be very valuable to us. You know, as we see what we would find some, you know, we've already mentioned foster care, child welfare. We've already mentioned those areas. obviously those are high-risk areas. You're dealing with high-risk populations. You are into problem-prone and high-risk areas already. That type of research perhaps could be beneficial to us, where we could standardize a set of KPIs across our states that we should all be paying attention. We can do a lot of other things too, add to it, that's fine. But these are some basics that, because of the high risk involved, we should be looking at some of these things across all of our states. That type of research could be beneficial to the practitioner.
Ben, do you have anything you'd like to add, or Patricia?
Not much, other than to say, I think one of the barriers to a partnership like this is Chinnu took responsibility for the researcher, and I'll take responsibility for the legislator. And I don't think many of my colleagues, myself included, fully understand what a partnership might look like, or exactly what you all do and how it might benefit us, or what, to John's point, what you need for it to be useful for your career path, and whether or not that meshes with our needs as legislators. So I think part of it is creating spaces to have that conversation about, this is what I'm interested in, this is what I want to research, and a legislator, committee chair, presiding officer being able to say, these are our interests, we want to study program efficacy, we want to study whatever, and then figuring out what the Venn diagram overlap looks like. But I don't know of much of that happening in my state, but maybe there are some states. Maybe Rhode Island continues to be a utopia for oversight.
I wouldn't call it a utopia, but certainly time is a problem. We're a part-time legislature, and I don't know if you folks are time or full-time. And honestly, I just don't know how we could engage researchers in the January to, frankly, the end of May session, the January to May length of our sessions, in order for them to, for us to identify a topic, ask one of them to research it, and then get back to us. I just don't know how we do that in a part-time legislature.
What about your
are you
interim
others full-time or part-time?
What about Patricia? Oops. Hold out my own ear. Patricia, what about your interim sessions?
We're both part-time, by the way.
Part-time.
We're both citizen legislatures, yeah.
Oh, okay.
What about,
and I'm having
using...
a little, excuse me, I'm having a little problem here because we have a terrible storm going on outside. So, and the wind is blowing, so I don't know what's going on. So I'm having a bit of a hard time hearing you, but I'll do my best. I apologize.
I was just going to ask you, Patricia, about the possibility of using the interim session. Our colleague Ben Ike has mentioned that some states use their interim sessions pretty effectively to foster studies, conduct studies, have studies conducted that are then presented when the legislature reconvenes.
Well, you know, we do have study committees, study commissions. If a problem in the legislature is identified, an outstanding problem, a committee chair will either volunteer or be appointed. And we do call outside folks with some level of expertise. I mean, for climate, we're an ocean state, for instance, and there was a significant problem here in the state with beach access, public beach access as opposed to private property. So some coastal experts were called in, and it went on probably for the length of the session, and they did come up with some recommendations, and they did solve a few problems for us. So I guess in thinking, oh, we can't do that, but I'm thinking now, yeah, we do that with our study commissions. So I guess that's an element of what you folks are referring to. And believe me, those outsiders are very helpful. They are existing experts in their field. And of course, they do this for gratis, and they share their time and their expertise. And those outsiders are helpful. But again, because I missed so much of this, I really have no frame of reference as to what I missed at the beginning. And
no, it's very, Patricia, that's very, very helpful insight. Well, I know we're beginning to run a little bit short of time. I think we have time for a couple more questions before we wrap up. I wanted to ask you all, obviously there's some research out there, some of this more on the congressional side, that seems to indicate that when you have unified government, one party rule, that legislative oversight occurs less often, or there is less activity around oversight. And, people speculate as to why that is. And, obviously you might assume that lawmakers who are of the same party as the executive branch may not want to do hard-hitting investigations that might turn up things that are not very positive about the executive branch or the governor who happens to be in the same party. But I wanted to sort of push on that idea a little bit and ask all of you what you think about oversight and whether oversight actually can be good politics. In other words, can you position oversight in such a way that even when your own governor, the governor of your party is running the state, that you're inclined to pursue oversight and do it in such a way that it's good politics, that it actually correlates with outcomes that are good, policy outcomes that are good, or public attitudes toward government that are good. Is this naive? Is it pie in the sky, or is it something that you think can happen? Is it something you've seen in your own careers, either on the practical side or on the scholarly side? Who wants to jump in?
I will. It absolutely can happen. It absolutely has to happen. If problem solving is your goal with oversight, right? I mean, that has to be your goal. And if it ever gets weaponized, if oversight becomes weaponized, then you're going to lose the trust of the public. You're going to lose the trust of the cooperation between the branches. You have to have a firm grip on the steering wheel with oversight. One of my reluctances, and I've voiced this already, one of my reluctances to creating an oversight committee, its own function of oversight. I mean, I'm just concerned that it can become powerful and weaponized, where problem solving is the goal. Absolutely, it can be very effective, and I have seen that multiple times in our legislature.
Mm-hmm. I thought John was going to say, if you've got members of the same party in leadership in the legislature and the governor's office, the solution is just take away party from the legislature, and that was going to be his answer. But he didn't say that. I totally agree, though, with what the speaker said. I think this is great politics, regardless of who's governing, especially right now. I'm actually thinking again of Polka's book, but people are feeling like government doesn't work very well right now, and they're partially feeling that because they're right. It isn't working very well. So John used the phrase solving problems. I'll use the phrase making government work. If you're approaching oversight in such a way that you're trying to make government work and you're trying to solve problems and you're not trying to embarrass people, you're not trying to have an adversarial relationship with the executive branch. In our oversight work group, we basically started our first meeting with almost pinky promising each other that this wouldn't be political football. That was the first conversation we had, is we're not going to turn this into, no offense to our federal friends, but this is not a congressional oversight committee where we're trying to get on TV and we're trying to do press releases. This is under the radar, and that's the way we want it to be for now, because we want to focus on solving problems. And I think in my state, at least, and I am a blue House, blue Senate, blue governor state, there's a huge appetite in the electorate of people who are going to focus on making things work better. So I think there's a big opportunity.
Okay,
Ben,
now I
ask
want
where you're from? I'm so sorry. Ben, which state are you from? I missed it.
I'm from Oregon and John's from Nebraska.
Oh, okay. And John, you're the speaker?
Yes, that's correct.
You're the speaker. Okay.
Yeah, and
Are we out of time?
It's a one house. It's a one house.
Yes.
Legislature, right?
Are we out of time?
No, we're not out of time. I just wanted to invite our academics to comment on this, because I suspect they are aware of some research. There's certainly some research that we're aware at the Levin Center that talks a lot about partisan incentives and theorizes, that lawmakers very often are motivated to use oversight as a partisan tool. But I don't want to suggest that to you. What are your thoughts about this?
Yeah, the 50-state study, we found that oversight occurs more often in divided government, sadly, in my opinion. But John mentioned earlier wanting to know what are the like the high risk, the really key things. Going back to my mention of Idaho with all its, various quirky things, we discovered in doing a report on contract oversight, that contract oversight is a place where all the states are hugely at risk because of the privatization of government, and the structures to monitor those private contracts lagged way behind the innovation. And Idaho is the leader, in our opinion, of the states that have solved the puzzle. I mean, first off, they have this completely balanced party oversight committee, but they had huge meltdowns. They had catastrophes. They got sued, and it cost them millions of dollars. It was a complete fiasco. So they went through and passed a constitutional amendment to change the way oversight of contracts works in that state. They worked with not the appointed executive branch folks, but the people in the bowels of the procurement office. And they ended up ultimately funding 2 new positions. They wrote manuals, and they now in their state train the people in contract monitoring within the state agencies. And those procurement office people monitor the contract monitors, and they have a conduit with the legislature. So it's a collaboration between the executive branch and the legislature, and they work very collaboratively. When I interviewed some of the people, they also wanted procurement people to come and talk at the same time. So I was talking to a legislator and a procurement office person. And they really are committed to getting these companies in line. And so it's a sort of a common enemy of both the legislature and the executive branch, not the appointees so much, because some of them have ties to those contract lobbyists, but the people in the bowels, the civil service part of the procurement office, are really on board with this. And they are really monitoring things. And they literally, in their corrections budget, wrote into the contract to outsource some prisoners to a facility out of state. They have money in the budget that the legislature provided so that somebody from the corrections office can fly unannounced to the correctional facility. They show up, they demand to go in, they see the logs, they literally are almost undercover, and it's a funded per prisoner part of the cost of the contract. And so they really have kind of, in a very collaborative way, made this very good politics, because they have shut down a whole bunch of really huge government waste projects, and good headlines, legislature steps in, works with, all the kind of stuff that appeals to voters in bipartisan stuff.
So Margaret, I would call that at the Levin Center, we would call that pulling a Harry Truman.
Okay.
Because Harry Truman made his name, for those who don't know about this history, as the chair of what became the Permanent Subcommittee on Investigations that Carl Levin eventually chaired. And he would show up unannounced at defense contractors during World War II and demand to see their operations and their records. And it was very impactful, and led to a lot of good outcomes, and certainly led to a lot of notoriety, positive notoriety for him.
And Jim,
Chinnu, yes.
On that point, Harry Truman doesn't become president without oversight. He gets picked by Roosevelt
Absolutely.
because of his oversight. So if we're talking about political upsides, Harry Truman's a great example.
He's a great example. Chinnu, I want to give you an opportunity to comment because
so I think this is a really important question. Even though the research is slightly, I think, discouraging, that shows that oversight increases in divided government, I think that there are incentives for both unified and divided governments to engage in oversight. So we issued a survey with of the Texas public in the aftermath of Winter Storm Uri, that massive winter storm from a few years ago that created all these outages and both public health as well as economic problems in Texas. And we had a fairly large survey respondent pool, and both parties were blamed by the public. But the biggest issue that the public took offense to was the lack of oversight. So the public rightfully recognized that there were oversight issues with ERCOT and with the management of the Texas grid that contributed to the fallout of this winter storm. And so I think that adopting the language of like preventive medicine is something that I think both unified as well as divided governments can gain from in terms of making oversight more palatable. And then also just the language of public service provision, good government, things that everyone benefits from. And I think those preventive medicine as well as good government, I think, is something that's palatable for all.
That makes a lot of sense to me in terms of my own personal experience and what we've seen in all the states that we look at around the country, that it's good politics because it represents an attempt to bring about good government. It's also, though, I think, and this is something we try to communicate to states that are single, unified government, is it's a way of showing that you're on the side of the people, that you're fighting for them. I think often when you have single party rule in a state, especially in battleground states where that may not be so secure, that those the parties that are in charge have a tendency to become vulnerable to seeming out of touch and arrogant and more interested in preserving their majority than they are with actually serving the public, at least being perceived that way. And so when you're doing oversight and trying to make government work, as Ben is suggesting, the politics can be good, and it doesn't have to just be this impractical thing that's only for those who are interested in the public interest. I mean, we all would like that, but of course we know that politicians are motivated by electoral, obviously, interests. Well, we have now come to 3:30, and I just wanted to wrap this up to say that I hope you've enjoyed this conversation. I've learned a tremendous amount from each of you, and I think we got into some very interesting topics. I think what we'd like to do is write up some of these concepts that came out of this conversation, because I think we did grope our way towards some potential areas where scholars and practitioners could do some more work. But I think we've got a lot more development to do to bring that about. Does anybody have any closing comments they'd like to make with just the last few minutes that we have?
I can just say one thing, if I may. Coincidentally, I was appointed the chair of oversight at the same time, as a Democrat, at the same time that our Democratic governor, Gina Raimondo, who is now the Secretary of Commerce, she had a huge failure in the state with launching a new computer system, UHIP, at the wrong time, when Deloitte told her they weren't ready, when the Human Services officers said they weren't ready. Well, she launched it anyway, and it was an epic fail in the state of Rhode Island. There was no way that the Democratic speaker and the Democratic chair of oversight could ignore the issue. And frankly, we had meetings and the public came to testify. Folks, there was just no way we could not call her out. Her failure was so obvious. And naturally, that created some friction between herself and the then speaker. And that, what can I say? That tension between them prevailed throughout her time as governor here. And frankly, she had other failures that I had to call out on oversight. So you can imagine the tension that existed. This is a blue state, blue governor, blue speaker, blue oversight chair, and it happened, and it's unfortunate, but it was her failure. And then she had others, and we had to just keep calling it out. And they were just so big, let me put it that way. There was no way we could have ignored them or looked the other way. So
I just wanted to quickly shout out Margot. The chat is incredibly, there's tons of resources that have been put in over the last hour and a half that I've been like frantically trying to click and keep a tab open so I don't lose it when the Zoom ends. But shout out to her. And if you haven't seen the chat, go click a few of those links. Thanks, Jim, for the opportunity. This was awesome.
Well, thank you all. Maybe there is a way that we can capture everything that's in the chat. Yeah, so it doesn't disappear when this is over. Or maybe Margot will come hunt me down and tell me I'm wrong about that. Okay, she says we're going to compile the links from the chat and share those with when we upload the recording. So hopefully that'll work for everyone. Well, again,
could I just say
yes.
one other thing?
Sure.
Ben Ike, I think, is monitoring all of this. Ben's coming out to Nebraska on Tuesday, so he's going to be speaking to this oversight group. Hi, Ben, and looking forward to more input from the Levin group.
Thank you,
We
Mr.
appreciate
Speaker.
the opportunity.
Not the Lincoln.
Yeah, we appreciate all the opportunities you've given us, both Ben, you in Oregon, and John, you in Nebraska, and we hope to do much more with both of you and with many of your colleagues around the country. Chinnu, thank you so much for joining us. It's been really interesting to hear your insights. Marjorie, as always, we appreciate all your work and all your insight and all your experience. And Patricia, Representative Serpa, hang on. We're gonna do something with you in just a minute.
I'm here.
We'll adjourn this meeting and thank you all again. And we'll move on to the next phase of the final phase of our symposium. Well, we have now come to sort of the last component here today, and I'm just so honored and pleased to have Representative Patricia Serpa with me today. We're about to do something that we have talked about doing for a long time, and we're really excited. One of the goals we have at the Levin Center and at the State Oversight Academy is to build a community of leaders who all across this country who are committed to conducting high quality bipartisan oversight. And to do that, they've got to be talking to each other. They've got to know about each other. We need to build a community, and we need to lift up the leaders who are really doing an excellent job as examples that others can follow. And so I'm so pleased today to present for the first time, the State Oversight Academy's Oversight Leader designation to Rhode Island State Representative Patricia Serpa. We are so excited about this, and I just want to say a few words about Representative Serpa that we learned in this process of considering nominations for this Oversight Leader designation. As Patricia Serpa has just mentioned and has discussed, she has been the chair of the Oversight Committee in Rhode Island in the Rhode Island House of Representatives for 8 years. And she has used that position to address a series of really important issues that range all over the map. State tax refunds, healthcare and software implementation that you mentioned a moment ago, behavioral health, non-emergency medical transportation, and the safety of children that are in the care of the state. The person who nominated her had great things to say about Representative Serpa, that she is somebody who is fair and open-minded and diligent, ready to come forward and study an issue carefully and then hold a hearing to let the public know about her findings. This has been a really important era of building oversight. It sounds like oversight is a top priority in the state of Rhode Island, and that is really great to hear. We think, though, it's partly because of leaders like Representative Serpa, who are upholding the principles of bipartisan, fact-based oversight and government transparency and accountability that it can bring about. So we're just wanting to extend this designation to you. You are our first annual oversight leader, Representative Serpa, and I want to congratulate you on behalf of the State Oversight Academy, all my colleagues that are working there, and the entire Levin Center. And I'd love for you to just say a few words, if you don't mind.
I don't mind at all, Jim, and thank you so much. I mean, it's an honor to be honored, and it's even more of an honor to be the first. I'm sure there were several other applicants you could have considered, but to be the first, really, this was unexpected. It's a thrill. And believe me, this is election season in Rhode Island, and politics in Rhode Island is a blood sport. And this award is going to be the showcase of my, honestly, this is thrilling for me. Because it came out of nowhere. And I want to thank my colleague, Representative Falella, for nominating me. She's a good person. She serves on the Oversight Committee. She's quiet, but she's thoughtful. And as I mentioned a few minutes ago, we kind of gained some momentum, unfortunately, on the back of a governor who had multiple failures. And I think once you gain that momentum and the public sees that you're addressing it and trying to fix it and holding the failing people accountable and calling them back for the corrective action plan and then implementing it, I think once you gain that kind of momentum, it's hard to come to a screeching halt and say, okay, now that's fixed, let's move on and be nice. And unfortunately, you do make enemies, you do hurt feelings, but that's part of the process. And it's never personal, it's never political. We try to keep those failings strictly business, and we get results. And I think I said in my comments, my written comments to you, that I am just amazed how much gratification they have to know that we're paying attention. Naturally, when you call out government, I don't know about the other 49 states, but when you call out government here in Rhode Island and you call out government leaders, it gets the media's attention. And people notice it when it's in the media. I've been thanked way out of my district here in Rhode Island so often for attending to this problem or that problem. And of course, as chair of oversight, they think I can fix every problem in the state. But it's not always pleasant, unfortunately. It's not always pretty, but I've been fortunate because I've been empowered by two speakers now who believe in the process. And hurt feelings aside, it's what will come out of it that makes it better for the people. And that's the ultimate goal here. We haven't perfected that, but we have certainly addressed some of the major problems where public users of the MTM transportation are now getting better service. One died because of an illegal driver with no background check, driving drunk. We've had children who died in foster care because, frankly, the social workers weren't tending. I mean, those aren't nice things to have to address in public, but we had to. And things are much better. So I get my satisfaction from that. I don't really worry too much about the political enemies I make along the way. And I don't think most of my colleagues do either. And I have a great committee of Democrats and Republicans. You can't worry about the political enemies because the friends you make with the public certainly outweighs the balance.
Well, I think Representative Serpe, you make a great point that it's so important not to make it personal. Obviously, some of these stories, some of these terrible incidents are, you can feel strongly about them personally, but to the extent possible, not attacking people who are in leadership personally, but talking about their performance, talking about the performance of their duties and what they're charged with doing in their jobs is certainly within bounds and the important work of oversight. Were we together in the same room, I would be handing you a plaque designating this, but
I have it already.
I know we sent it to you, so I hope you have it, and I hope you'll find a place to put it that people can see.
It's going to be in the premier. It'll be in the premier spot in my office, provided I'm reelected. But I think I'm even going to put a picture of it on my campaign literature. Really, this is a thrilling award, honestly. And I hope the next person to receive the award is even a better oversight chairman than I, because it sounds like it's in its infancy in a lot of states, but it can be done. It is being done, and We just want to make it better. So I thank you again from the bottom of my heart for recognizing this. It really is the ultimate honor to get a national recognition like this. So thank you to all of you.
You are most welcome. And with that, that concludes our presentation of the award. I want to mention, though, that this is going to be an annual award. So if you do have thoughts for other candidates to be an oversight leader, please let us know. Please reach out to us at levin-center.org, and you can make your nomination. So I'm now going to turn things over to Ian McKnight, who's going to wrap things up for us. Ian?
Yes. Well, thank you very much. And Representative Serpa, congratulations again. This is just so exciting.
Thank
for
you.
us as well. Well, thank you
It
all.
is.
Thank you for joining us today for our second State Oversight Academy Symposium. And what a great day of compelling discussions it's been from all of us here at the State Oversight Academy and our broader Levin Center. Thank you for choosing to spend your summer Friday on this marathon Zoom. We are so proud to be in the rare and fortunate position to bring together experts from academia and the practice of government to make sense of the world and make it a better place. I hope you have found this program to be helpful and inspiring. The team and I are so pleased that we've been able to get such a great range of state-related papers this year. We're already planning for our next time around. If you're interested in this field of study, please keep in touch. We would love to connect with you and even have you join the program for next year's symposium. Outside of academia, if you work for a state legislative institution that does, or perhaps should be doing, oversight work, we would love to visit. You too can join the ranks of state legislatures who have benefited from Levin Center expertise for professional development, committee training, ongoing advice, and much, much more. Finally, if you enjoyed this today, I know you'll also enjoy our other State Oversight Academy programming. You can learn more at stateoversight.org, where you'll find information on upcoming and previously recorded events, browse and contribute to our comprehensive state legislative oversight wiki, and sign up for our newsletter to keep up with what we're up to. I think that's all I've got. So from all of us here, thank you, and we hope you have an excellent weekend.